it should have given us all opportunity to that we are expected to make good use of. But nevertheless, maybe as we progress, others will join us. It's nice to have everyone here. Like MJB management already said, we had the first batch of this mental health training some time ago, and I was called upon to train on the second batch, which is indeed a pleasure. I'm happy to be here to continue and to complete what I actually started. Thank you for being here. So as dear participants, before we start, I want you to try to declutter your minds. What I mean by decluttering is, you know, there's so much going on in the society, so much going on in our environment. So at this point, I want you to just take a deep breath in and out. Do it 3 times so that you feel a little bit relaxed. Forget about the fees, the children's school fees. Forget about anything that would come as a distraction to you as we progress. Forget about the money you would have to give for feeding and whatever. So that's why I started by saying declutter your mind. Just put away anything that would keep you thinking as we progress. So, but before we move forward, please let's adhere to the normal rules that we already know when it comes to Zoom trainings. Please let us mute our mics. Thank you so much, because I can see that we've all adhered to that already. Then if at any point you have a question to ask, you can drop your question in the chat box, or you can pause me. I don't mind. You can pause me if you have a question, and I'll give you permission to go ahead and answer and ask your question. So that's how we are going to be going. We've started a little bit behind schedule this evening, so we are going to need to take that time as we progress, because I want everyone to go along to ensure that you leave here filled with the necessary knowledge to take care of your health and your mental well-being generally. So once again, before I start, as it is in my tradition, I love to hear the voices of everyone. So I want to start by saying good evening to everyone. It's nice to have you here. Please, can I hear your lovely voices? Can everyone?
Good evening, Doc. Good evening, everyone.
Okay, good evening. I can hear a sweet lady's voice. I don't know our men. Our men, good evening. All the men, good evening.
Good evening, ma.
Good evening, ma.
Good evening. Thank you for having me. Good evening. Thank you. Thank you. I think that's better now. Okay, so at this point, I'm going to share my screen, and I will need to find out if you are able to move along, if you can see my screen. You let me know. I have just shared my screen. Just a minute. I don't know why it's giving us this. Oh, Jesus. Okay. Please, I don't know. Can you see my screen?
Yes.
I'm just trying to, I don't know what.
Yes,
I can see
Yes,
your screen.
we're seeing it.
Okay, fine. I'm trying to see how to get this open. Okay, good. So, please, if you can see my screen, just tell me what do we have there on the first. You tell me what's there if you can see, so I will be sure everyone can see that.
Yes, ma. You can see the heading of today's lecture.
Thank
Professional
you.
course in mental health awareness.
Okay, thank you so much. So we are together. Okay, so today we are going to be looking at mental health. And before I start, I want you to imagine something. Just imagine a scenario whereby you just wake up on a fine day and the things that you used to love, your favorite color, has lost that beauty. Maybe you love the pink color or the purple color, and you just wake up and look at it. It suddenly lost the beauty. Your favorite songs that you used to like now sound dull. Even the sunniest day, you feel forlorn, you feel weak, you feel sad, you feel withdrawn. All of a sudden, don't forget we are human beings. Okay. In the African setting, those of us that are Africans, in the African setting, when we talk about mental health, what first comes to mind? Or we talk about mental illness, what first comes to mind is the picture of a madman. That's what comes to mind. Up until I began to explore the mental health sector, so many years ago, when I hear someone talk about mental illness, what comes to my mind first is, oh, the mad person. Oh, this person is mad. That's what comes to my mind. And to us Africans, we paint a picture of a man with dirty dreadlock, maybe a man with dirty dreadlock hair, moving around naked on the streets, maybe picking things from the gutters, talking anyhow. That is what comes to mind when someone talks about mental illness, especially in Africa and in these parts of the world that we come from. So we all know this man. When we talk about a madman walking on the streets, all of us can relate to that. You can paint the picture even as I am talking. That's what comes to mind when you hear mental illness or someone is mentally ill. Now, this man, our parents warned us about him. My parents have personally warned me about him. And when I asked my parents, Mommy, why do you say I shouldn't go near that person on the street, or what's happening to that person? They just tell me, oh, it's drugs. That person, he has gone abused drugs. He is on drugs. That's why he is mad. And if you as much as look at drugs, you be like that person. That's what I was told, when we talk about mental illness. And I grew up with that perception that mental illness is just the picture of a madman. I just have it in my mind. And that's what happened. Thank God for this training, mental health awareness, that is going to make us aware of our mental health. It's going to disabuse our minds towards a lot of things, that's perceptions and ideas that we've had before now. In our setting, in our world setting, in Africa especially specifically, if you come down with pneumonia or you have cancer, you find out that your parents will rush you to the nearest hospital for treatment. You tell your mother, oh, I have fever, or I have cancer. Someone is.
What is that pace in your life? Who is that woman like giving you pain? Don't focus on the person doesn't exist. Focus on God, and you see God change that person. Amen.
Excuse me. MJB management, please can you do something about who is disturbing us? Who is disturbing us, for crying out loud? We've just finished giving the rules, and this is happening. Please, maybe you just take the person out if the person is not willing to cooperate. One person cannot cause confusion for us right now. So as I was saying before we had that interruption, when someone come down with pneumonia, and your parents will rush you to the hospital or any other illness, they don't waste time. But once they know that you are having one illness or the other, you are taken to the hospital. They're just there to declare depression. Just tell them you are depressed, or they see you depressed. You see them going, they will get your local pastor to cast and bind everything out of. Some may even think, oh, my village people have finally caught up with me. They will be casting and binding the demons, blaming it on witches and wizards because you said you have depression. So it is important for us to understand that we as humans, we are going to see the prevalence of mental illness. Now, according to World Health Organization, mental health simply refers to a state of well-being where a person can realize his or her own abilities to normal stress of life. Simple. That is mental. If you are mentally healthy, it means you can with the stress of you can have. That's what World Health Organization also. It also refers to the emotional, psychological, and physical well-being of a person. Are you well? Are you strong? Now let's come back to the African setting. Now, globally, in the entire world, we've been talking about access, can be found in countries that are underdeveloped or are still developed income countries. That is where you find 75% of this mental illness. Now, most in the knowledge this, you also discover that most African one on mental health. You can imagine a severe shortage, Africa. Now, in this whole Africa, we have shortage, a severe shortage. You can easily get a pediatrician. You can easily get an optician, or you get people that specialize in other fields. But when it comes to look at psychologically, administer therapy to people that are mentally ill, it is a problem. We don't get those done not readily. It's important the way a person has pneumonia or any other, so they do not prioritize it at all. So if we have just 1% of the healthcare budget kept for mental illness or mental health, then you understand what that means. You understand why it is important for us to have this training. Now in Nigeria, it is estimated that of about 200 million, of almost a million Nigeria. Ninth of people illness, of that population are exposed to mental illness. And in all of Africa, these people lack access to treatment because I have people that are specializing in that particular field. They lack access. As a result, they suffer in solitude, silenced by stigma. They suffer in solitude. They cannot tell anybody because of how the society, because of how they, excuse me, the world have prioritized even less priority to mental illness. People are afraid, and stigmatization, people are actually afraid to come out. And what actually kills those people? What actually makes them commit suicide at the end of the day? What actually makes them suffer at the end of the day? It is the fact that they cannot speak out. And why can they not speak out? They cannot speak out because of the weight of stigmatization, because people laugh at them, because they will be called, they will be tagged the madman, because they will be tagged maybe perhaps parents that have a mad child, and so on and so forth. So you see that this particular mental illness we are talking about, mental health awareness, is very important. I expected to see so many people on this platform today because I am always very passionate whenever I'm asked to talk about mental illness, because I have seen it all. Like I've had reasons to really be very passionate and emotional when I talk about it. So like there was people suffer because of solitude, silenced by stigma, because of what they are afraid, how they are afraid of being attacked. They prefer to die in silence. They prefer to be withdrawn, to recoil. And at the end of it all, it results in suicide that we get to hear every day. So we as Africans, by the fact that we are Africans, we are already wired to respond to mental health with distance. And once we know someone has mental illness, the person is not fine, distance ourselves from them. Ignorance too comes into play because we just think that we have so many myths surrounding mental illnesses. So when someone has depression, or the person has schizophrenia, or the person has bipolar disorder, or the person has autism, or any of those illnesses, we just distance ourselves. Why? Because already the stigma is going to be attached to us as people that are friends or family with the person that is actually having the mental illness. So There was a case, before we delve into it, pardon me, let me talk a little bit about it before we look at the slides. We will not have to really delve too much into the slides if you understand what I am saying before we go into it. You know, there was a survey that was carried out by Abolida Flores some years ago. And she wanted to find out what people thought about mental illness. She had a survey. She went into the community. She carried out the survey. She asked people of their own idea, of their own perception of what mental health was, or what mental health is, or what mental illness is, and what causes it. And 34% cited drug misuse. 34% said it was as a result of misuse of drugs. Oh, when you misuse drugs, definitely it results in mental illness. 19% said it was the divine wrath and will of God. That was the will of God. Perhaps karma was back to pay the person that whoever. You know, some says divine wrath, that is God's punishment on those people. Some said 12% said it's witchcraft and spiritual possession. They feel that, witchcraft, it's possessed by witchcraft or spiritually, I don't know. So few of them, only a very few cited the known causes like genetics, like war, like loss of loved ones. Only few people were even able to decipher and say that. So you see that the stigmatization against mental illness often results in the ostracizing and demonizing of sufferers. They are ostracized, they are demonized, there are times they are even tied with chains, they are even flogged. So many things happen to people that have mental illness. Why? Because the society is ignorant, because the people that do these things are ignorant. They don't understand that we as humans, that we are prone to be depressed as a result of one thing that happens to you, or you are prone to be anxious, to have anxiety disorders, or you are prone to have one illness or the other. So let's see. For me, like I talk with passion, the stigma is personal. When I talk about stigma, how these people are treated is personal. Some years ago, I had a friend, but before I continue, I'd like to find out if everyone can hear me. Can everyone hear me?
Yes, ma'am.
We can hear you. But there's a noise from a newborn.
Yes, we can hear you.
We can hear you. We can hear you. Sorry.
Okay, so that's what is actually disrupting us. Please, let's just try to do what we have to do so we don't stay here more than 9. Because
sorry, madam, forgive me.
Okay, who is asking for the forgiveness? Is it the person that
It's me.
Okay, it's fine. It's fine. We have nothing to forgive. Thank you for asking for that forgiveness. So, like I was saying, the stigmatization against mental illness, if you know the way these people are treated, you will not like it. So as for me, it is personal. I like to talk about, anytime I'm asked to give a training on mental health, I love it. I feel very emotional about it because I've seen it all. So many years ago, I was a student. When I was a student in the university, I had a friend, a beautiful lady of blessed memory, a very beautiful lady. She was filled with life. Even then, she lights up anywhere, wherever she sets her feet, everybody, she just lights up the place. She has that charisma. She has that poise around her. So we've been friends. We had other friends as well. We were about 6 of us, a group of 6. We always sing together and going from one lecture hall to another and doing the normal things that we know together. So this, my friend, was diagnosed. As time went on, we observed that she started exhibiting some kind of attitude. She was diagnosed with bipolar disorder. She had bipolar disorder. And initially, she didn't know. Then we didn't know as well. I wasn't this well read, so I didn't know. We just felt what could be the problem. We'd advise her, go and do tests. Why are you like this? We tried to walk into her to actually find out what was wrong with her, but we didn't know. We didn't understand what was wrong with her. So as time went on, she was diagnosed with a bipolar disorder. And by the time our friends knew that she had bipolar disorder, I observed, I can never forget that scenario. I observed the whispers. Like I observed people's behavior. We were 6, don't forget, and we were students in school that time. I observed people started moving away from her. People started avoiding her. People started, I heard the whispers. I heard the murmurs. I heard people talk in twos and in threes. They will, have you heard that Sarah has gone mad? Some people would say, have you heard that Sarah has gone bonkers? We're hearing different kind of, some will say, those that are used to speaking Pidgin English, say, Sarah, you know that beautiful Sarah, she don't colo. You know, you hear some things like that. You say she don't colo, oh, she's this. They started withdrawing away from her. In fact, as much as people didn't even want to sit near her in the lecture hall. Why? Because they are afraid that when they are seen with her, automatically the stigmatization is attached to you that you are a friend to a madman. So eventually you've become a madman or you've become a mad woman, as the case may be. So that was the things I saw. I heard derogatory statements. I heard words that I heard people use words to talk about Sarah. These were words that they could never think of using when it comes to people that had pneumonia or people that had diabetes or people that had cancer. They couldn't use those words. They were empathetic towards those ones. But in the case of Sarah, because of the stigmatization attached to mental illness, it was terrible. It was terrible. You know, but so somehow I got to know that somehow when it comes to mental illness, our ignorance evaporates all sense of empathy. Our ignorance, because we don't understand, evaporates all sense of empathy. We don't sympathize with these people. We don't empathize with them. Rather, we stigmatize them. Rather, we ostracize them. Rather, we treat them in a way that is not good. Hence, these things that I saw made me to become passionate. I had to say, no, I was going to delve deeper into mental health and mental illness. Let me see, because I was touched by that plight. You know, it's actually hard for someone to get out of mental illness when you have no friends. But it's hard for you to make friends when you actually have depression or you have any of this mental illness. What I'm trying to say is if you had friends before you had that mental illness, keep the friends, because as soon as mental illness sets in, it's difficult for you to have friends and it's difficult for you to even keep the friends that you had. So over the years, I watched people struggle with depression and severe anxiety. I watched it and they were not able to speak to anyone. They were scared to speak to people. And I must tell you that I equally too had some phases of depression. I had some phases of depression and I was equally scared to talk about it. I was equally scared to share how I felt with others. Why? Because, wow, I didn't want to be tagged the mad woman. I didn't want to be tagged, you know, I didn't want to be given that stigma, that stamp that would be on me. So I didn't want to tell people. So I watched other people to struggle with anxiety and they couldn't talk to people. So deep is our fear of being the madman. So deep is it. But what we forget to understand is that our trauma does not taint our strength. It doesn't. As humans, your trauma, what you go through, depression, anxiety, you have maybe grief, issues that really grip you. It does not taint your strength. It doesn't make you not to be a man. It doesn't make you not to be a human being. No, it does not. So we need to take our mental health very important. We need to take care of ourselves. We need to ensure that anything that will affect your mental health, please, like like I would say in Pidgin, I would say jump it and pass. That's jump and pass. Jump it and pass. Anything that will affect your mental health. So that's why we are talking about this topic today. For our men, like it is, we are being suffocated by the men, especially because, you know, men are used to be hard already. They are geared towards being hard, especially African men. They don't show weakness. They don't show emotions. So imagine an African man to seek for help when he's depressed. Oh no, he feels it will attack his masculinity. It's going to attack his virility. Oh, he will be less of a man if he does that. So some men do, not all. You know, they are suffocated by the rigid architecture of our African masculinity. Like things fall apart, like Okonkwo and things fall apart. We African men, they neither process or express their emotions. They don't. Rather, they deal with their problems like men. So it is important that we take this training. Before I delve into the slides as fast as I can, not to keep us for too long, it's important that we understand this before I even go into it, that you At any point that you are faced with depression, you are faced with anything, please share. Please share it, reach out to people, talk to people, see a psychologist, see a loved one. And as we are having this training, one of the major reasons is to emphasize that we, at the end of this training, we must have learned a lot to know that the worst thing we can do is to stigmatize a person that is passing through mental illness with the right knowledge. So without wasting time, let's just move ahead to what we are looking at. This training is going to be divided into 4 modules. 4 modules that, like we can see here: introduction to mental health and mental illness, depression and its treatments, anxiety disorder, and suicide. So we have talked practically on introduction to mental health and illness. We've said what mental health is. That is just a state of well-being where a person can realize his or her abilities to cope with normal stresses of life and work. I don't know why we are. Please just spare me a minute. I don't know why this thing is actually okay. So fine. So are we together? Can we see my screen?
Yes, ma'am, we can see your screen.
Okay. I'm seeing as if there is something like something actually showing there, but fine, let's move on. I don't know what's actually happening. So mental health, like we can see here, is a state of well-being that a person is where a person can realize his abilities to cope with the normal stresses of life. So some tips that we can use, some tips that can help us try to relax. For you to take care of your mental health, try to relax and reduce stress. Find ways to relax. With the way I relax may not be the way another person would relax. You know, I can, like me, if I want to relax and take my head away from worries and maybe stress, I just look for a very nice music that I love to watch, and I just relax and feel refreshed and really, really good. So some people may decide to maybe take a walk, maybe to go out, do anything, maybe sit with family, like maybe elderly people, they love to be around their grandchildren. So if you have grandchildren, you can bring your grandchildren over, relax, they run around, you shout, don't do that, don't go there, don't jump there, you know, and you just relax. How to be intact, find ways to learn and be creative. Learn, do things that make you happy. Spend time in nature if you are that time. Spend time in nature, go to your garden, look at your beautiful roses, look at the stars in the sky at night, things that make you refreshed. Connect with others. You cannot be enough personality that you have. You know, relate with others. Family meetings, attend functions, you know, that will keep you alive, because it goes together, it works pari passu. So look at your physical health. Try to improve your sleep. Try to sleep and rest. Try to rest regardless of anything you are doing. Please try to rest. Thank you. So thanks to our men that will always say, oh, they have to, and our women too. These days, women do that. Work around the clock to ensure there's food on the table. Yes, I appreciate that. You need to take care of your family because, of course, you're an African man. So, but at the same time, you need rest. You need to relax. You need to ensure that you are in good state, because it's only a healthy person that can lend a hand. It's only a healthy person that can take care of, you know, others. So these are things that we need to understand. Our mental health is very, very important. Try to sleep, try to rest, try to have your life and rest. So let's look at the next slide, which is the mental illness. I don't know why this is actually showing. I don't know why I'm having this. Okay, let's just try to see how to go on. So mental illness, what is actually this mental illness? It is a disorder. It is a disorder, and it is diagnosable. When you start seeing someone like I talked about in the beginning, that is how do I put it? That is not all the time you see maybe someone that is mentally ill move on the road like a madman. No, there are different types of mental illness. And so you may even have someone that is actually having mental illness, but the person is being affected. You know, the person is not being affected like the person you actually see on the streets. There are different types of mental illnesses. So it's easily diagnosable. When you actually know what it is, then it's easily diagnosable. You know what to do when you have the right knowledge. So it can also cause major changes in a person's thinking, emotional state, and behavior. When a person is mentally ill, it causes changes in the person's thinking. The person begins to reason another way. The person begins to reason so many things. Oh, the world has suddenly come to an end. What is the point? Why am I alive? Why am I passing through this? Oh, my mates are here. And differently, when someone has then this mental illness too can disrupt a person's ability to work and to carry on their usual relationships. When someone has mental illness, of course, the person will not function as he or she is supposed to. So it affects their ability to go out, especially with the stigmatization. They cannot interact because, why? Because of the fear of stigmatization. And that fear kills faster than even the mental illness. Let us cast our minds back to when the inception of HIV/AIDS, when we first had HIV/AIDS. When we had that HIV first, it was first known, you know, so many people over the years have died. Why? Not because of the illness. Now you agree with me that with the awareness, people understand that you can even die of cancer, you can even die of pneumonia, you can even die of leukemia faster than HIV. So people understand these things. And because people understand these things, they are no more afraid to come out and speak out. They are no more afraid to disclose their status. They are no more afraid to go to the hospitals to get their antiretroviral drugs. So you see, awareness is very important. Most of the things that actually killed those people was as a result of the stigmatization. So they prefer to die in their particular challenge instead of others knowing that they actually have it. So you see that is how it is with this. So mental illness is something that we cannot even accurately have a good statistics of people that have mental illness because so many people are not coming out to speak out still. The level of awareness has not reached that point. Thank God we are having this training. So everyone on this training would have work to do afterwards. We'll have work to do to ensure that people get to understand everything about mental illness. Okay, so it can disrupt a person's ability to work and their usual relationships. Okay, now let's look at this mental illness. There are different types of mental illness, like we can see here. We have, like you can see here, you see schizophrenia disorder, you see anxiety disorder, you see depression disorders, you see bipolar, you see personality disorders. There are so many. The list is endless. Dementia, autism, a whole lot. They are all mental illnesses. So you see, it's not all mental illnesses that end someone moving on the road and, you know, like that, like we perceive. So, or we used to see. So these are different types of mental illnesses. Just a few. There are so many. There are so many types of mental illnesses. So now we are getting to a very important segment. Now we want to look at depression as being one of the causes, the most common cause of suicide. Depression. Depression. What is this depression? We are going to see it when we progress up to that point. So just know that depression is one of the causes of suicide. You see many people that commit suicide. Today, you hear this one jumped off Third Mainland Bridge. You hear this one committed suicide. It is getting rampant every day. It is getting monotonous every day. And the earlier that we begin to handle these things, we begin to understand what to do when we have people that are passing through depression or are passing through one mental illness or the other, the better and the less we would have occurrences of suicide. So depression is one of the most common cause of suicide. And it needs to be understood so that you'll be able to understand how to address suicide risk. When you see someone that is showcasing all the features showing that he or she wants to commit suicide. So let's see. I don't like doing much. At the point, I'll have to stop and ask questions. I wouldn't want to monopolize this training. I want it to be interactive as we progress. So depression and anxiety are the common mental disorders. You know, depression and anxiety. That's to say that it is very highly prevalent, like you can see, it's highly prevalent. We are going to look at the statistics of depression. Most of these mental illnesses are not common. They are not common. There are some that I'm sure that if I even mention their names, they will sound strange to you. They are not common. But I don't think depression sounds strange to anyone here on this platform because it is very common. It has a high degree of prevalence, you know, as they occur more frequently in the population other than all other mental illnesses. Depression, common cause of mental disorders. So let's look at. Good. So now looking at the survey of mental health and well-being, you can see there that they say most, the statistics found 18% of the population met the criteria for a high prevalence mental disorder. Almost 10% suffered from anxiety disorders. Substantial numbers suffered from more than one disorder, particularly a substance abuse problem. So you see that difference, if it's not depression, it's anxiety disorder. If it's not anxiety disorder, it's schizophrenia or bipolar disorder, or and so on and so forth. So there is high level of prevalence. That's to say that people are definitely bound to have one of this mental illness or the other. I'm trying to see what can be done. All right, fine. So please, are we together? Can everyone hear me?
Yes, ma'am, we can
Yes,
hear
ma'am,
you.
we can hear you.
Okay.
Yes,
So
ma'am, we can
now
hear you.
I'm all right. So I'm going to pause at any point. The reason I'm not asking questions from the beginning is that I want you to sit relaxed and to just try to visualize all I have been talking about. Just try to empathize. Just try to feel like if you have anyone that has mental illness, or try to think of yourself. How well have you been taking care of your mental health? Even as you are listening to me, try to visualize and understand the importance of mental health. I tell people, even at work, you may work all the time. But if anything happens to you, I tell you the truth, it doesn't take. In fact, if it takes one day, then it means you are a highly important person in your workplace, up to maybe 1 week. Let me not say one. That means you were very valued. You were highly valued. It doesn't take long. In fact, the next day you'll be replaced. You would be replaced. So there are many things, even as workers, as fathers, as mothers, we should be conscious of that fact that nothing should be topmost in your priority list like your mental health. Because mental is not easily seen. Like if you break your leg, everybody sees you when you, God forbid, nobody will break leg on this platform. But I'm just using that as an illustration. Maybe someone has a broken leg and then everyone sees it, see blood gushing out, sees the wound. Oh, sorry. Oh, they empathize easily with you because they can see it. But mental health is psychological. It's emotional. People don't really see it at a glance. So it's difficult for people to empathize with the society and everything going on. It's easier to empathize, but very difficult to empathize with you. So it's important that we know this. So on this particular slide, we are looking at comorbidity or dual diagnosis. Sometimes people are faced with a situation whereby they have more than one mental illness. You can find someone that is having depression, that is depressed, and the person also has bipolar disorder. You can find a person that has bipolar disorder. The person also has anxiety disorder. You can find a person with anxiety disorder. The person also has schizophrenia. So you see that there are situations where a person can have more than one particular mental illness. And such situations is what is referred to as comorbidity or dual diagnosis. So people that are having more than one mental illness, you can, excuse me, just excuse me. Okay, so like in this case, if people that are having maybe one or two situations whereby they have they have two or more mental illnesses, they are prone to, imagine, it's difficult for you to even handle one mental illness, let alone you are having more than one. Maybe schizophrenia and having a bipolar disorder. So it's difficult to handle it. So these people, especially people that are comorbid or people that have dual diagnosis, they are prone to suicide. They are the ones that, because they have this and they have that, it's difficult to just handle, and everything just comes to them at the same time. And maybe they lack the right knowledge. So they just, they just feel they should end it all as being the solution. So comorbidity is actually associated with greater impairment, higher risk of suicidal behavior, and greater use of health services. So these people are prone to, you see them staying in one place, you see them withdrawn, you see them battling with these illnesses, and the worst case scenario is if they are not even able to share how they are feeling, or they don't have the right help, you can imagine what those people will actually pass through. Look at it as humans on this platform, as human beings. Let's relate to it and see that mental health is very, very important. Let us look at prevalence of mental health. Prevalence of mental health. Hello, please. Are we together?
Yes, ma'am, we are together.
Yes, ma'am.
Can you be loud a little? Can you guys be louder a little?
Hello?
Can you be louder, be audible a little?
Okay, we can hear you. I can hear you clearly.
I said, can you be audible a little? Because it's not too high here, and I'm not with my earpiece.
Can everyone hear me?
Yes, ma'am, we can hear you.
I can hear you. I can hear you now.
I can hear you, ma'am.
Okay. I'm trying to be audible. I'm trying to be audible. Okay. So as I was saying, previous mental disorder. Now let's look at our statistics. Mental health problems are the third biggest health problems in the world. It is even more prevalent than heart disease and cancer. It is more prevalent than heart disease and cancer that we get to have every day, So mental health problems are the largest cause of premature death in Africa. Already we know that, like I already talked about, every day suicide, every day people kill themselves because, when they are handling this depression, they bottle it up. They cannot talk to anyone. Nobody understands them. They don't have the right knowledge. They don't know what to do. They bottle it up, and before you know it, what do you think they would do? They just decide to end it all. So 1 in 5 has had a mental disorder sometime in the past 12 months. So you see, that every one of us, if not everybody, to a large extent, we have had this. And look at the ages 16 to 85. Between that time, you either have one of these mental illnesses or more than one, as the case may be. So it is very, very, very prevalent. It is very, very prevalent. Stigma of mental illness. Stigma again. We talk about stigma. Okay, before I continue at this point, so that I will not have to do all the talking and all the talking, I have started by giving you an overview of what it's about. I've equally talked about stigma. Please, I would like to hear from the able professionals on this platform. I would like to hear from you. I would like you to share your experiences, because I am in the world and we are all humans. If we have not been affected by mental illness one time or the other in our lives, then we most likely would have a relative that have had mental illness, or would have a colleague or a friend, or or a child, or anyhow, somewhere, somehow, we must have experienced mental illness and how these people are being treated, maybe an experience or so. I would like someone to share I would like everyone rather to share their own experiences. How do you think people with mental illnesses are treated? What do you think you can do as being on this platform? So far, we've not gone to the other aspects of the training yet, but at this point, as I am on this stigma, I want to ask you to share your views with me. Let's try to rub minds. I don't want to monopolize the training, because I don't like feeling the way I am. I always feel this way when I have mental health trainings, because I've seen it all because of my friend, so it's just been there. So at this point, please, I'd like someone to build a case. Let someone open the floor by giving us, sharing something with us, maybe something you have experienced or something you have seen and it has touched your other side as a human being. How did you feel? How did you feel? So please, the floor is open now. I'll just give you the next maybe 5 minutes to share.
Maybe from my angle as a sociologist, a psychologist, and a criminologist.
Wow.
And presently doing I have a diploma in social works and presently doing a master's in mental health. Beautiful. I want to actually come from the angle of sociology. I want to come from the angle of sociology, especially the area of sociology of illness and sickness behavior. In Africa, to be precise, anytime we have issues that have to do with mental health, there's one thing that we actually feel, or we have an assumptive knowledge that the person is infested with bad spirit, or the person is possessed. And Professor Chris, one of the renowned scholars in mental sociology of mental health and illness, always advocate for the concept of syncretism. When we say, if we are to treat mental health, let's come up with this eclectic approach to handling issues that have to do with mental health. And my postulation here, being my master in this, do you advocate for? Don't you think that we Africans, we should always be we should apply this or adopt this syncretic approach to handling issues that have to do with mental health? Are the psychological approach, are they really enough? It's a question that I will leave hanging. So because when you say take him to that medicine man, how do we look and say the person is diabolical? Take the person to this, and even we know ourselves that anytime you hear that somebody is not this abnormal psychological, the next thing that comes to our mind, you already know you target spiritual. So the things that are spiritual should go with spirit. And that's my case here.
Okay. Thank you. Am I speaking to? Let me be sure, because it appears we are really going to be working together, because we just need to fight this mental health. I think I just finished talking with Mr. Edafe. Am I correct?
Yeah. That's me.
Okay, Mr. Edafe. Okay, thank you so very much for that. For that contribution. I really appreciate that. Like when I started, what you have said is very correct. You've just put the nail on the head on what I had already talked about. You know, we are highly spiritual. Africans, we have this mentality all around us, you know, that would take a long time for it to fizzle out. The mentality of us taking everything spiritual. I'm not with due respect to my clergymen here and you know, yes, everybody, we all have a supreme being, but sometimes the ignorance makes us to do certain things that we shouldn't do. So fighting mental health, really, we should look at it holistically. We should approach it with a neutral mind. We should approach it with in bearing in mind that these things are bound to happen as humans. Not everything goes in that angle. So thank you so much, Mr. Edafe, for that contribution, for sharing your knowledge with us. Thank you. So do we have any other person? I would love to hear the voice of...
Thank you. I appreciate it.
Right, sir. So my gender, the ladies in the house, does anyone have anything to share? Please don't allow men, only a man to build a cat. I would also want to hear a woman, a lady too. So who is ready to build a cat for the ladies? Share an experience with us or say something. We are all human, something you must have seen or something you feel should be handled, you know, just say something. Yes, my ladies, the floor is open.
Good evening, ma'am. Good evening, ma'am.
Good evening. Good evening.
My name is Florence. I want to add a little to, yes, ma'am. I want to add a little to what Mr. Edafe said. There is spiritual. I think we should read up something called Messeron theory. So there is it shouldn't just be one approach to treating it. If there are people, correct. Yes, ma'am. If there are people, that part of therapy works for is spiritual. So it's being explored right now, so we can look at it also from that angle. Thank you.
Thank you so much. Thank you, Florence, Madam Florence, for helping to build our agenda out. Thank you. And so, thank you too for your contribution. You are very right. They say not how do I don't know, I'm looking for the idiomatic expression that really suits that, you know, different strokes for different folks, really, if I look at it primarily. So what suits best? We should explore all the avenues. So the one that suits best, we use it depending on the scenario, depending on the person. There are so many theories in mental health. When we want to talk about it, since this is just a certificate course, by the time you delve into a diploma in mental health properly, you move into the masters in mental health, like Mr. Edafe said, and others. That's when you get to explore and you diversify, dissect, and you understand these things in detail. But primarily, for the purpose of this training, it is advisable that we make use, or we use the right knowledge as it appears with or when relating to people that are having this mental health, depending on their own situations. So thank you so much for those beautiful contributions. For now, so others that have not said anything, please just get ready. Your questions are in the pipeline. We are getting them. So we are looking now at stigma. Stigma can have a severe impact, like we already talked about that. The stigmatization, the need for these sufferers not to be stigmatized, not to be ostracized, cannot be overemphasized. We cannot overflock it, because it's a major thing. It's a major hindrance in us making sure that people are aware of mental health. They are beginning to be aware of how to handle these things, because if they already have the mindset of stigmatization, they already have the mindset of calling, of already tagging the person that has one mental illness or the other, a mad person. So a madman, as we do in our African context, then it becomes difficult. The purpose is defeated at the end of the day. So stigmatization can have a severe impact. It can reduce access to opportunities and even resources. Stigmatization, it can lead to low self-esteem. Imagine a person having depression, maybe suffering from depression. How do you think that person would feel? if that person is stigmatized or the person is aware that, oh, I cannot speak. Oh, no one has to know what's wrong with me. I can't tell someone that I'm having anxiety disorder. No, I cannot even share because they will laugh at me. They will speak out. They will call me names, derogatory statements. They will whisper. There will be whispers around. There will be murmurs around concerning me and so on and so forth. It kills their low, it leads to low self-esteem. It attacks their self-esteem naturally. Because we are humans, it's just a natural phenomenon, you know. So, and it can increase isolation and feelings of hopelessness. When these people are stigmatized, oh, you are pushing them to the wall to really actually carry out what they have in their minds, you know. It can make them to be withdrawn, to be isolated, to feel hopeless, to see as if there's no way forward, to see as if the end has just come, nothing can ever work. And discrimination to an abuse, like I said, in some settings, they are even flogged, they are even tied with chain. Oh my God, there are so many things that happen to these people that pass through this. So it's important that we know how to go about. So let's see what we have. So there are so many myths about mental illnesses. There are so many myths about mental illnesses, and what can they be? What are these myths? Like we have on the slides there, you can see. Some people think that it affects a few people. Some people have that mindset. Some feel that, oh, all mentally ill people are violent. There must be those that will have to, you know, throw stones at you, want to run at you, you know, attack you. No, it's not so. So all this practically are myths that are surrounded, that surrounds mental illness. Some people feel that people with mental illness cannot work, or they cannot do anything good, or they can never get better, or they must be kept in the hospitals or in an insane asylums or in a psychiatric, you know, they think there are so many myths surrounding mental illnesses. So I'm still looking through the chat box. No one has dropped, like I said earlier on. Okay, please, can someone tell me, please, on what's on this slide? Because I'm seeing someone say, I cannot see your slide. Someone has just dropped that message, please. Are we on slide 15? Mental health. What can they be? Myths about mental illnesses. Are we there?
Yes, ma'am.
Okay.
Yes,
so
ma'am.
I'm wondering what's happening, because I've seen someone put there on the chat box that your slides are not changing. So I'm really surprised if that's true. So since we are all here, it means it's actually changing. So maybe it's from that person's end. So like I was saying, these are some of the myths, some of the things, the misconceptions that we have surrounding mental illnesses. So now let us look at depression now. Let's look at one of the major mental illnesses is as we progress. Like we can see on depression, 28 million, you can imagine, suffer from depression, making it the most common mental health disorder on the continent. So you see, something that we really have to look at. Okay, but before we move, let's see. Let's look at this video. Let's see if this video is actually audible. Please, I would need to know if you are able to hear what the video is saying before I practically start it. Let's go. Okay.
Depression is the leading cause of disability.
Okay, please, this is a video. I want us to just take time. I don't like my trainings to be talk, and type. I like to diversify, to vary them, because variety is the spice of life, as we know. So just sit, relax, and watch this video. You learn one or two things. It's just about a minute or so. It's not a long one. So let's get to it. You learn one or two things from there before we actually continue.
Depression is the leading cause of disability in the world. In the United States, close to 10% of adults struggle with depression. But because it's a mental illness, it can be a lot harder to understand than, say, high cholesterol. One major source of confusion is the difference between having depression and just feeling depressed. Almost everyone feels down from time to time. Getting a bad grade, losing a job, having an argument, even a rainy day can bring on feelings of sadness. Sometimes there's no trigger at all. It just pops up out of the blue. Then circumstances change, and those sad feelings disappear. Clinical depression is different. It's a medical disorder, and it won't go away just because you want it to. It lingers for at least 2 consecutive weeks and significantly interferes with one's ability to work, play, or love. Depression can have a lot of different symptoms: a low mood, loss of interest in things you'd normally enjoy, changes in appetite, feeling worthless or excessively guilty, sleeping either too much or too little, poor concentration, restlessness or slowness, loss of energy, or recurrent thoughts of suicide. If you have at least 5 of those symptoms, according to psychiatric guidelines, you qualify for a diagnosis of depression. And it's not just behavioral symptoms. Depression has physical manifestations inside the brain. First of all, there are changes that could be seen with the naked eye and X-ray vision. These include smaller frontal lobes and hippocampal volumes. On a more micro scale, depression is associated with a few things: the abnormal transmission or depletion of certain neurotransmitters, especially serotonin, norepinephrine, and dopamine, blunted circadian rhythms, or specific changes in the REM and slow wave parts of your sleep cycle, and hormone abnormalities, such as high cortisol and deregulation of thyroid hormones. But neuroscientists still don't have a complete picture of what causes depression. It seems to have to do with a complex interaction between genes and environment, but we don't have a diagnostic tool that can accurately predict where or when it will show up. And because depression's symptoms are intangible, it's hard to know who might look fine but is actually struggling. According to the National Institute of Mental Health, it takes the average person suffering with a mental illness over 10 years to ask for help. But there are very effective treatments. Medications and therapy complement each other to boost brain chemicals. In extreme cases, electroconvulsive therapy, which is like a controlled seizure in the patient's brain, is also very helpful. Other promising treatments, like transcranial magnetic stimulation, are being investigated too. So if you know someone struggling with depression, encourage them, gently, to seek out some of these options. You might even offer to help with specific tasks, like looking up therapists in the area or making a list of questions to ask a doctor. To someone with depression, these first steps can seem insurmountable. If they feel guilty or ashamed, point out that depression is a medical condition, just like asthma or diabetes. It's not a weakness or a personality trait, and they shouldn't expect themselves to just get over it, any more than they could will themselves to get over a broken arm. If you haven't experienced depression yourself, avoid comparing it to times you've felt down. Comparing what they're experiencing to normal temporary feelings of sadness can make them feel guilty for struggling. Even just talking about depression openly can help. For example, research shows that asking someone about suicidal thoughts actually reduces their suicide risk. Open conversations about mental illness help erode stigma and make it easier for people to ask for help. And the more patients seek treatment, the more scientists will learn about depression, and the better the treatments will get.
Okay, so please, I don't know how many of us were actually able to get something from that video. Was it clear enough? Was the volume audible enough?
Yes, everything was clear.
Okay.
It was clear.
Okay, so let's, from that video, I'd like to ask, I don't know if Mr. Edafe or any other professional here could tell us just in one sentence, what is actually depression, or what we just finished watching. What is depression? Like maybe a layman just walks to you and asks, what is depression? So what would your response be? Can anyone help us from that video? Or better still, let me rephrase my question this way. I just need someone to tell me one thing that you took away from that video, maybe something you learned or something you remembered, from this video that we just finished watching, practically, that talked about depression. What have we learned from it? So please, someone should help us, at least someone that have not heard the voice on this platform. Not Madam Florence now or Mr. Edafe. Since it is clear enough, someone should just say one thing that you learned, something that stood out in the video. Thank you.
That depression, my name is Jacinta. That depression is a mood state, and events can trigger feelings of depression. For instance, you book an appointment and the person doesn't turn up. That could be a depression, a feelings of depression. You are sad, but that can easily go away. Probably something has happened, the person shows up. So that is something that happens day to day. But clinical depression is different from the normal depressive feelings that people have due to occurrences during the day. So, and then clinical, for you to diagnose one to be having clinical depression, it would have lasted for at least 2 weeks, he said. I'm not looking at your screen.
In fact,
it would have lasted for at least 2 weeks, and at least 4 of the numerous 5, is it 4 or 5 of the numerous symptoms he mentioned would have been present within that period of 2 weeks. Then in that case, the person is needing an intervention.
Wow.
That needs to look out for help from professionals.
Thank you so much, Madam Jacinta. Thank you so much. But where have you been since? I'm surprised I'm just hearing this lovely voice for the first time. And that's not very, thank you so much for that response. That's practically one of the things I wanted to hear, because in the course of my doing the mental health training, people have told me, oh, I'm depressed. Oh, I am depressed. Or I was depressed 2 days ago. When so happened, they will narrate the story and tell me, oh, does it mean that I'm now passing through, I'm now having clinical depression, or I need to see a I need to see a psychologist, or I need to see a therapist, and I just laughed. Because why? Because most times it's in human nature. Maybe you just woke up on the wrong side of the bed and you may just be depressed that day. So that doesn't mean, or maybe the next day, maybe something just happened that can easily go away. You are just sad for some time or for that day. And that one is you are being depressed. But depression is a clinical situation. It's something that needs to, like we have here on this slide, it's a state whereby at least it has to take at least 2 weeks. At least an interval of 2 weeks, because you can't just conclude. There are certain yardsticks that you have to, by the time we delve properly into, maybe like you have a higher qualification in mental health, you get to see how it is diagnosed, you get to see all these other parts. But for us on this platform, we just want to talk about the awareness, like to make people be aware of their mental health and be aware of mental illness. Don't run away from these people. Do something. This is what you can do on face value. This is how you can help them. You have a wife that is depressed, you have a son or a relative that is always, so there's a difference between being depressed and depression. Thank you so much, Madam Jacinta, for that. I'm so happy to know that we have very seasoned professionals on this platform. So like we have on the slide now, you can see there that at least, even when you have those 2 weeks, you still have to combine it with at least 4 symptoms from what you are having there. You have to be sure that, okay, you look at certain yardsticks for you to be able to say that, yes, this person is actually having clinical depression. You cannot just draw the line like that. Thank you. So let's go, because our time is moving very fast and I don't know why it is doing that. Now we want to look at, okay. Now we have what we call the DSM-5 criteria.
Hello,
pardon?
I'm sorry to interrupt you, but
please don't. Go ahead.
You mentioned about depression and depressed. So there's differences, right?
Yes,
and you
yes.
That a person, if a person like a relative is depressed, is there anything like at home first aid that we can do before he or she attend a psychiatrist or look for a therapy?
Okay, sorry, sir. I am finding it difficult to coordinate but what I understand, I don't know, I'm going to rephrase the question. So you tell me if that's what you want. What you are saying is, you are buttressing what I already said, that there is a difference between being depressed and depression. Am I right, sir?
Yes, ma, that's what I mean.
Yes, actually, yes, there's a difference between being depressed. Being depressed is something that can happen. Maybe there are days myself talking to you, there are days I don't, for one reason or the other, I don't wake up on the right side of the bed. That's to say that I'm not happy. I just wake up and I'm feeling somehow that day, I'm feeling down, I'm feeling depressed, as if, that's a common thing. But you need to, I can't just say because that's happening to me, I now say, oh, Jesus, that means I'm mentally ill. Like the Africans to do, oh, Jesus, you know that I'm gradually getting mad or something. You know how we always attribute madness when we talk about anything that's got to do with mental illness. No. We get depressed. So there's no cause for alarm. It happens to everyone. It happens to everyone. Every day doesn't just go smoothly, or someone does something for you and you just get depressed. You just recoil and you are withdrawn for that day and then you are out of it. That's not depression at all. Depression is the difference, like what that video, that's why I said that it's important for us to get the facts from there so that we don't take time to really delve into it. With depression, there are differences because it's more intensive. If we continue in that pattern for a long time, we continue in that pattern. Now it's not an issue of maybe 1 day thing or 2 days thing. You continue in that pattern. The things you love to do, you don't do it again. You don't like to attend functions again. It now becomes intensive. That is when you look at, you say that it is depression, and you consider the factors that are there. And you cannot, as a person that doesn't have, you're not a specialist in that area, you cannot 100% or even 50% ascertain that, yes, I am clinically, as in I have clinical depression. No, you cannot. It's just like a person that is having fever at home. You may just use your experience and say, okay, I have fever. It's like I have malaria. That's why my body is hot. But you cannot you can't be 50 or 60% sure that you actually have malaria. You cannot, because you cannot you are not the doctor until you get to the hospital and the doctor carries out the test and confirms that you actually have malaria. So that's how it is. When you have you are just depressed 1 day or 2 days, it's something that can happen to anybody. You just get up and shake off the depression, being depressed, and move on. Or the next day you'll be better. You just carry on like that with the activities. But depression is a clinical issue. It affects your life. It affects your relationship with people. You become withdrawn. You begin to behave somehow. People that are close to you begin to sense and see that something is wrong. Then with that, since you have the knowledge, like we are on this platform, we are not meant to be mental health specialists. Because of the training certificate program, you just have to have the awareness as to know what to do, so that we can reduce the suicide rate, we can reduce all the things that are going on in the country. You can help a person when you see the red flags. You can refer the person to a mental health, a psychologist. You can refer the person to know what to do. As we progress to where we get to suicide, I do not know really been able to left us hear me, or whether my network has started again. I was asking if everyone could hear me, because at the point I was lost. Are we together?
Yes, ma, we are together, but your screen is not showing.
Okay. That's what happens when there's a network fluctuation. Sorry about that. But once there's any network fluctuation, the screen goes off. It's on now. I guess, can we see the screen now? Is it better?
Yes, we can see it.
Yes, ma'am, we can see it now.
Sorry for that. That's one thing. When one's network just fluctuates a little, the screen goes off. That's what happens with Zoom meeting. So yes, so that's practically it. I believe I've been able to answer that question. So let's quickly move to the next slide. Difference between grief and depression. Now there is a great difference between grief and depression. Sometimes someone can be grieving, but grieving and not being able to overcome your grief can lead to depression. That's what I want us to understand. So now, what does this grief do? Grief is just maybe you lost a loved one, or maybe something else happens to you, then you'll be grieving, or you lost a loved one. Let me just use that one. That one is easily relatable. So losing this loved one, you are grieving. Things are going on. So many things is going on with you. Now, if you are not able to handle this grief, the long-term effects is that it can metamorphose into depression. So what is the difference between grief and depression? Grief does not significantly interfere with your ability to carry out your task. If you're a worker, your grief will not, it will not really affect you in doing the things that you need to do. It will not affect you. Even if it affects, it will be a very temporal thing. It will just, because you are grieving, and after that you are back to doing your normal things. And grief does not significantly impair your family or social activities where you have been previously engaged. You've been purposively engaged there. You have been engaged there doing the things you need to do. It doesn't affect you if you are grieving. But one thing I want you to understand is that depression is more intense. Like I said, it's a persistence. That word persistence is important to note. It's a persistent condition that lasts for weeks. It's not just something that lasts for months and even years if it is left untreated. That is why it is important that when you observe that someone is following a particular pattern, being depressed, having the tendencies, that depression tendencies of being depressed, then you have to do something about it before it metamorphoses, gets serious, because it can take time. It can move into months, it can move into years. So that is practically it. So we shouldn't confuse grief with depression at all. Shouldn't confuse it. Even though if you grieve and you are not able to snap out of your grief, gradually that grief will make you begin to think the whole world has turned against you. Begin to think that, why am I even in the world? Why am I even living? No, I just have to end it all once and for all. You understand? So it is very important for us to know that while these grief and depression are distinct experiences, they can sometimes overlap. Sometimes, for example, that is long, like I said, from one grief to another, maybe losing many 2 or 3 loved ones in it. You can imagine how that kind of thing is. That person may develop symptoms of depression. And in such cases where you see that the person is not able to stop out of the grief, it is essential.
Your screen is not showing.
I don't know. I just pray that network doesn't give us stress. It's
if the screen is not showing, if the screen is not showing, it means that your network is weak. So you just hold on and it will come back with time.
Okay, thank you, sir. I need my screen to show because it's important. Thank you, sir, for that for that. So I guess it's right now. What I do is that once the network weakens, the screen goes off, I have to put on the screen again. So I believe we can all see it. Are we together? Can we see it now?
Yes.
Are you sure the full screen is captured? Look at the end. I don't think you capture the full screen no.
Pardon?
It's like did you capture the whole essence of your screen?
It is. The screen is, let me get back to
the last line is the last line on your screen complained of poor sleep for the last 3 weeks.
Yes.
Is that what you have on the last line?
That's correct. That's
very
correct.
Good. So it's full.
That's correct. It's full. There's no, the last sentence is, I noted she was crying. Her mood has been low and she has complained of very poor sleep for the last 3 weeks. That's the last sentence. So it's good. We are good. So referral pathways, I was
saying. Sorry, it's a full screen. Thank you.
Okay, sir. All right, sir. Thank you. Thank you for your observations. Is helping me to function better. So thank you too. So as I was saying, you can help. I was talking about a husband. You know, things like everywhere is hard. So we are having issues of depression here and there. Some could be as a result of financial challenges. So we should begin to be more observant, because with things happening, if you've had a once lively husband, maybe it was at the top as with high spirit, doing everything, and all of a sudden you observe the withdrawal scene, give him joy before the current situation, he no longer delights in doing them again. You read the signs. For God's sake, if we have knowledge, that's why I say people perish because of lack of knowledge. If we know the right things to do, I tell you that most of the issues we've been having, most of the deaths and maybe issues we've been having would have been maybe nip in the bud before it fully gets to those positions. So it's important for us to be very observant. Like you have a son, you have a child that is 247 inside the room, a big grown-up boy that is 24, maybe a university-age child or maybe secondary, because now depression starts even in the primary. You get children that are depressed, that are having clinical depression, not depressed this time around. You know, so if you as a parent is not observant, you are all about work, all about rushing to put food on the table, but you forget there is a healthy body alone that eats food, that will be able to eat food. So some of these things we should be referral is to reduce and treat the symptoms of a condition. That is it. It's not to do all those things. Now, here, let me quickly give you an illustration because I like to give stories along when I go. You know, I have worked in a school. I said it the first time I had the first batch. I worked in a school so many years ago in a big school, a very large school, whereby I had a child that had issues. He had a mental, he was bipolar. You know, he had a mental illness. So the parents, because it was a big school and, you know, it was a school for the wealthy children, you know, where your child is in that school, like, yes, they say you have class and all that, you know, the mentality of some people in this part of the world. So this woman brought her child. She knew that her child was bipolar, had bipolar disorder. So, but as a parent, you have to disclose your child's health status in the form for admission. You have to, if your child has any underlying illness, you have to state it there so that the school will know how to relate with that child. That's one of the conditions, you know. But this woman, the mother of this child, kept quiet. So the child was actually placed in my class. Then I wasn't a mental health specialist. Like I was just so many years ago. So I observed that this child wasn't doing the things that other children would do. Like this time, the child is throwing tantrums. The next time, the child is doing another thing. I observed that the child had some issues. As at that time, I didn't actually place my finger on what it was. So I tried reaching out to the mother because I like to deal with children a lot. I'm a woman with many sides. I have many sides. When it comes to children, I like to see how to bring the best out of them, from them. I have different things I do. So in my class, I observed that this child, the behavior and all, so I drew the attention of the school authority to the issue, and they sent for the mother. They talked to this woman, like even I talked to her, woman to woman, like I am a mother too, mother of four children. You know, so I spoke to her. I was like, Madam, this child, I've observed this and yeah, she said, no, maybe it's the school environment. My child is not like that. My child is not like this. I said, me that I have taught for many years, I've been in this teaching profession from when I was very, so I don't understand. So I spoke to the woman and I expected her to understand, but she did not. She didn't, because why? Just because of the fear of being tagged the mother to a mad child or a mad whatever, like our society paints these people. So you see how great stigmatization is. It even supersedes the welfare, the well-being of a child. The stigma goes, it moves very far. The mother did not even look at, okay, let's see how to work out modalities and ways to help this child. She wasn't concerned about that. She was concerned about her face, her reputation. She was concerned about the fact that she did not want to be stigmatized, or she didn't want another person to know that the child was actually having issues. But of course, we cannot hide such issues. That's it. It's like a pregnant woman saying, I don't want anyone to know I'm pregnant, but you are just deceiving yourself, because pregnancy does not hide. When it's time, it's come out. So that's what happened with the mother. So the mother did not, this woman, did you know that it took a whole lot? She still refused. She still said, in fact, at a point, she said she was going to sue the school because the school was painting her child. But no, I wasn't doing that as the class teacher. I studied education. Like I studied early child psychology, whatever you can think about. So I told her, no, ma'am, that this child, the earlier you come out clearly on a white paper, on a white slate, and let us know how we can help, best we can help this child. If it means referring the child to a special school, you know, who know what to do. There are special schools for children with maybe autistic or bipolar or whatever. But this woman refused. This school I work for is a school for, that's normal, as in children that don't have defects, you know, don't have one challenge or most of these mental issues. You understand? So, but she brought her child there because of the school. She just wanted to make a name for herself. So at the end of the day, because of pressure, at the end, we got to realize, we discovered that the child had bipolar disorder, and the mother knew that even in their house, when her visitors come, she doesn't allow this child come to the sitting room. They have to practically lock the child inside the room, because the child will come and showcase some, you know, come and show some attributes there, and the visitors may be embarrassed, or they may begin to know what's happening to them. You see, so she prefers to lock the child. So why did I bring this illustration? I'm just trying to let you know the weight of stigma. The weight is heavy on people. People don't come out, people don't talk because of stigma. So as we are on this platform, please, let's diffuse the stigma. Please, let's try not to do this thing, so that the more people become aware that they can seek help. That is not a death sentence when you have the clinical depression. It's not a death sentence when you have a schizophrenia, or you have a child that is autistic. It's not a death sentence. That you can really help this child to live a normal life. The more people begin to be aware of these things, the easier it is for people to come out and break the stigma and move beyond the stigma to seek and get help. So referral pathways, these are simply ways, things you can do. You can refer the person to a specialist. You know, at the end, with the person's permission, you know, you can consult with a specialist. You can also see how best, maybe even you can even take the person there if it's a family person, or maybe your child or anybody. Once you see the signs, do not hesitate. Once you see the signs, do not hesitate. Try to see how best, if it is a husband, because it is not easy, especially for a wife. When you see the signs, God forbid, on a man, husband on this other side, like I told you, men don't like to come out when they have issues. They see it as attacking their virility, as attacking their masculinity. You know, they are already suffocated by the rigid architecture of our African masculinity. You know, a man must be a man. How dare you show that you are weak? How dare you show you have depression? What is wrong with you? You know, all those kinds of things. It's gone are those days, for God's sake. The mental health is more important. Our well-being is more important. Because of course, if you break down, that masculinity will not come into the picture. It doesn't come. So practically, that's what we are looking at. So these are some things you can do. Never give a diagnosis if you are just maybe you are just trying to help. Don't say, this is my husband, his head has touched, or his head don't touch, or like if you want to use, or this might, no, you don't do those things, because you cannot conclusively, you cannot say that this person is actually having mental illness until the person is seen by a mental health professional or specialist. You know, that is when they can carry out the test, the DSM-5, they can look at the criteria, people that are into it, they know what we are talking, what can be done. They follow all the the assessment, they assess the person practically to know if this person is actually having what is actually happening. You know, never give a diagnosis and use thoughtful introduction. Maybe you could say, I am worried about my husband, or I'm worried about my wife, or I'm worried about my son. He's been having this mood. His mood has been low. He's eating. He has been withdrawn. He keeps to himself. So when you say these things to a specialist, now you leave it. A specialist knows what to do, you know, to carry it on from. Don't say, this is my son. This my son has been behaving like a mad person, or this my son has been behaving as if he's on drugs or he's on something. No. You don't do that, because already you even telling the person himself or herself that he's mad or is behaving like a mad person is already a form of stigmatization. You let the work to be done by a professional that understands how to go about it. So let's move to the next slide. You can equally
Hello.
Okay, you can equally have, I don't actually know why this, okay. You can equally have the supportive counseling. You know, when you get there, when you take the person there are different methods, there are different things that will be carried out, you know, assessment that will be carried out there. Supportive counseling, clarifying the myths about depression. That's why they need counseling. These people need counseling, support with anxiety about medication, a range of therapeutic techniques. There are so many things that could be done as a specialist in that field. There are so many things. So there are medication myths too. Some people think that depression is natural, nothing can be done about it. So therefore, people think medication won't be able to help them. Yeah, some people, you know, our mindset, people think that medication, this person, our spiritual beliefs, so this person is like this, the person is withdrawn, the person is having this particular mental illness. No matter the drugs they give to this person, medication won't work. It cannot be able to help. It won't help. You know, these are myths, these are misconceptions that surrounds medication when we talk about a person having depression. So fears also that medications can be addictive and will be needed for life. Yes, about the fear. You know that even my father, my late father of blessed memory, used to take hypertensive drugs, used to take some of them like that, you know, while he was still alive. And I was like, there was a time I kept telling him that you don't have to be taking these drugs, because my mindset as at that time was like, if you take these drugs, of course you are going to take it all your life, and you automatically become an addict to be taking these drugs all the time, you know. But those things, what I forgot to understand is that he needed the drugs, and of course he needed to take them. You understand? So this for him to be fine, for his blood pressure to be regulated. So medication, I want us to understand, medication helps, and it does help. It is often necessary to restore chemical imbalances, because mental illness has got to do with imbalances in the brain. Imbalance, you don't reason again the way other people are reasoning. So many things are not balanced in your brain. So it needs medication, it needs other, because this medication, like one of the ladies about here, it will prepare an avenue for alternative therapies to be more effective. So if the person could be taking that drug and then going aligning with the therapies, depending on what the professional, the mental health professional, or the therapist is doing, or the psychologist is doing. So these are things that we need to understand. So with that, let's look at the next slide, which is anxiety. This takes us to the third slide, the third module for this training, anxiety. Anxiety, this talk of anxiety made me to remember something that I would like to share with you. It's just relax and let me share this story with you. Some years ago, I shared it with the first group. Some years ago, I was actually asked to make a presentation. I was asked, I think that was my first or second presentation, if I'm not wrong, first or second presentation. I was actually asked to make the presentation, and I was so excited about it. At the time I studied, I was, you know, on point. I said I was going to give this presentation. I did my research. I looked at the mirror. I spoke to the mirror. Someone smiled, and the person is actually obstructing. Let's see, who is that? Ime, okay. Dorcas. Dorcas, and Dorcas,
Yes.
please help us to
Yes,
mute your
madam.
mic. Thank you.
Okay, please.
Okay,
Okay.
thank you. Okay, so I was talking
Yeah.
about anxiety. I said that so many years ago, I wanted to make a presentation. I always like saying it. The reason I like saying this to all the groups that I have trainings for is that I can never forget that word anxiety. Anxiety can strike. Pardon? Anxiety can strike at the most inconvenient times. This thing they call anxiety can strike at the most inconvenient times, and it often affects us when we need to perform our best, especially when you have a presentation. So let me just tell you this story. I was asked to make a presentation something like I was saying. And normally I am somebody that if I enter anywhere, the room is lit up. All right. I thought that we could just do what we have to do and leave, but some people are still going against the rules. Okay, that's fine. So as I was saying, I had a presentation to make. I had prepared, I was like, there's no big deal. I got dressed, I had my coffee, I headed to the office, but something happened. As I walked into the office, after all my preparations, as I walked into the office, the conference room, beg your pardon, not office, the conference room, I had to make the presentation in the conference room. I had a whole lot, as at that time I didn't have my PhD, so I faced so many people in their academic regalia. They were seated, and so many people, the audience, we had so many people in there. So, don't forget I told you that I had practiced, I had prepared. Oh, I was on top of the game in high spirit. I was going to go and do the presentation. You know what? When I got there, immediately I entered into the room, the conference room. My God, the butterflies in my stomach seemed to have invited all their friends to have a meeting. My stomach now started all of a sudden, as if butterflies inside my stomach. Immediately I headed into the hollow. Up until I went there, I wasn't bothered. I was so confident. So they called all the other people that were seated. The closer it got to my name being called, the more intense the party was in my stomach. Like the noise and the butterflies in my stomach. And my mind was hitting, the butterflies were disturbing. In fact, I cannot even explain. I can never forget that scenario after 20 years or 25 years ago. So it's not even now, but I cannot forget it. By the time they actually and finally introduced me into the platform, oh my God, it was now a full-blown circus, like the butterflies had become elephants. They were everywhere. I stood there, I walked to the front of the room, I faced these people, but suddenly my mind just went blank. I mean, me that was prepared, that went over that, my mind just went like a white paper blank. My palms were sweaty, like sweat all over my palm. My palm was like sweat everywhere. I was like, Jesus, what is this? What is happening to me? It attacked my confidence. I didn't even know. My palm was sweating, and it felt as if I was swimming inside water. You can imagine, I don't know how many people have had that experience, but I know we are all human, so we are bound to have anxiety. We are bound to be anxious at any point in some points, or at some points in our lives, we are bound to be anxious. So, do you know that as I made a fool of myself, let me use that word. I opened the slides. Even when I opened the slides, the first, second slide took me to all the slides, like all the slides like that. I was so confused. I fumbled with the remote to ensure to see how to regularize it. I was destabilized totally. But then, after some time, I cleared my throat. Tried again. I tried to pull myself together, and I said, after all, this is not. I glanced at the note. Even when I glanced at the note that was typed in English that I was about to present, all of a sudden it now looked like something that was typed in French. Like I was beginning to look at it. I looked at it and I was wondering if I actually typed it in French or I typed it in English, because I couldn't read anything anymore because of what? Anxiety. Because of anxiety. So with that, I took a deep breath and I decided to be honest, because they were looking at me. I decided to be honest. At that point, I took a deep breath and said, oh, it's like I'm feeling a little bit anxious right now, but As I just said, I'm feeling a little bit anxious right now. Everybody put their hands together and clapped. So immediately they clapped in that hall. It gave me a little, the butterflies now relaxed a little for me to be able to get a little composure and move along. The whole room clapped for me and they erupted into laughter. Everybody laughed. So because I realized my anxiety and it made it relatable, it made it show that I was actually human. Yes, I know I didn't get what I would have gotten for that particular presentation 25 years ago. I didn't get the mark, but the beauty of it is that I learned to walk past it and I learned to handle such challenges. It made me a better person. And maybe that was one of the things that really gingered me into going into mental health to see how to go about it. So now, that's just a story I want to share with you. Let us look at the slides. Let's look at what we have. Anxiety. What is anxiety? It is a normal, healthy reaction. The reason I told you that I wasn't having an anxiety disorder, I was only anxious. I only had anxiety. So anxiety is actually good. It's actually healthy. Everybody gets anxious, especially if you have to meet a target. Your boss has told you, I need to get this document. You know, I need to get this done. I need to get that done. Normally and ordinary, as a human being, you are going to be anxious. So that's anxiety. So everybody gets anxious at a time. It happens to everyone when you are confronted with certain life situations, maybe events, you want to do your wedding. Of course, you get anxious. It is just normal. And it occurs when there is perception of maybe danger or maybe there's threat or psychological, you just have to impress my best. So automatically your body is stereotyped that and you become anxious. So moderate anxiety can be useful and energizing. That's what I want us to know. So being anxious is not a mental illness. Just as I told you that being depressed one day or two is not a mental illness. It is normal for every human being. But where it becomes a problem is this. Let's look at the next slide. Now, when does anxiety become a serious problem? It's when it becomes a disorder. That is when that anxiety becomes more intensive. It becomes more intensive. It's not something one time, it becomes more intensive. You are not able to handle it. You are not able to, it's a continuous thing. Anytime you have to give a presentation, you have to do anything that is challenging for you, the next thing you become anxious. It becomes a problem when it is more intensive, when it lasts longer, when it leads to development of fearful behavior that limit your ability to relate to the environment. There are some people out of anxiety, they don't even go out. They cannot face a crowd. They cannot go where there is a party or where there are more than a particular amount of people, maybe a large gathering. They are never able to. I have a friend like that. When it comes to going out where there are many people, she'll just say, no, I'm not going to. No, I cannot. There are so many people there. No. Everyone will just be looking at me. I will feel so. So you see, as at that time, I did not understand. That's why knowledge is important. I was like, is this girl even normal? That wouldn't want to, something that students will want to go out, want to go and see what's happening outside and want to go and socialize. And you are saying you want to stay inside. Everybody looking at you. What was so important about you that everybody looking at you? I did not understand that time. But the truth is, it happens to people. And when it is intense, it becomes at least one major area of a person's social life is affected. Now, I want you to understand that anxiety disorder is a clinical condition that requires professional treatment, such as therapy. Disorder, when it becomes too intense, then you have to get something, you have to do something about it. I also have a friend that before she attends before she gives any presentation, she has to go drink. She would make sure she takes alcohol, she takes something, say, no, I just have to be high. I need to be high. If I'm not high, I will not be able to do that thing. So I told her, for how long will you continue getting high? You get high until you will not be able to come down from that height that you want to get high. So people are different and people are being affected one way or the other based on how intense they have this. So they need therapy, they need medication, they need or a combination of both. It could be the medication and the therapy. They need to do something about it. And also, it is important for us to note that addressing anxiety disorder early in life is important to help a person regain control if you first sense it, that you have anxiety issues, and you see that it's not once, it's not twice, it's a persistent thing, it's lasting longer, then it has to be addressed. You have to seek help before it gets before it gets out. You need to seek help.
Let me see it. Because your own is a TV show. You don't know a TV. Let me see how they can.
Please, let's mute our mic. We are matured enough. Mute our mic.
I don't know. We are,
Mrs. Douglas, please mute your mic. Mrs. Nelson, or mute your mic. You are disturbing.
As the host, you have a right to mute them. So just do that. Who is the host?
You are muting them, they are unmuting. When you mute them, they unmute it again.
Then log them.
All right.
Down.
Let's go ahead. Thank you, MJB. So as I was saying, we need to address these issues. When we have them, we have to be very fast to handle them, because just like any other illness, the earlier and the faster we handle it, the better it is for us, the better it is for you. If you leave it, the more you leave it, the more serious it is. So that's practically what we need to note. We need to note, just like depressed and clinical depression, there's a difference between anxiety and anxiety disorder. Anxiety is a normal thing that gets to us when we are faced with maybe doing something that looks challenging, but a disorder is when we are not able to handle the issues that come with that anxiety. We are going to look at it as we continue. How common is this anxiety? Anxiety disorders are the most common form of mental illness found in the population. It's one of them. Depression, remember we said depression and anxiety are the most common. Those two work hand in hand. Most times there's a comorbid situation. That's to say some people are having depression, clinical depression, as well as having anxiety disorders. In such situations, have a comorbid. So they are known as high prevalence mental illnesses. I think what you can do is there's a way to send that person out. Disturbing us, please kindly do it.
I think I'll remove her. Let me remove her.
Please just do. I don't even if the person has paid, we'll return the money. The person is obstructing and we are talking, she's not doing it. Just send the person out, please. It's not about the money, it's about the things what we have to do. All right, so like I was saying, comorbidity, we can have situations where a person has anxiety disorders and at the same time is having depression, clinical depression. So when we have such situations, that's where comorbidity comes in. Most of the people you see, people have real problems. I must say, people have real issues in life. You see people just look very nice, move on the streets. You cannot imagine what happens with so many people. So the earlier we are able to contain with these things, the earlier we are able to know how to handle our mental health, the better it will be for us, because so that it will equip us better to be able to handle situations anytime they arise is important. So we have different types of anxiety disorders. We have the generalized anxiety disorder, we have panic disorder, we have phobic disorders, we have post-traumatic stress disorder. This post-traumatic is what comes after a traumatic experience. This one actually most times affects people. People maybe the people that are in the military, maybe that have fought the war and so on and so forth, post-trauma. Those things keep playing back as music. Those life situations they saw, deadly threatening situations keep playing back. So these are some of the disorders that examples of disorders that we have. So let's look at this picture. Now look at this. How does my body react when I'm anxious? You can see, just visualize. This is exactly how I guess my body was on that day I had that presentation to make. You see, mind racing, sleep disturbance, that's so many things. Your butterflies in your stomach, sweating, wanting to run, restless. Your knees can just turn to become like jelly, very soft, as if your knees wouldn't be able to carry you again. So these are some of the likely things that go on with us when we are anxious. I think some of us can relate to what we are talking about. We must have had that experience before now. So let's look at stress. Yes, now I want to pause, take a break, and talk about stress. Because this thing they call stress is something that is very important for us to learn about it. Because stress kills people. Every day we get to hear, it's because of stress. You can have one illness. You'll be told, oh, maybe you go to the doctor. The doctor will say, you stressed yourself too much. You need to rest. You need to rest. You need to rest. You need to rest. Hearing it everywhere, here and there, you know? Yes, because we should not joke with ourselves. We are talking about mental health here, your mental well-being. Everybody feels stress. It's a normal thing. We feel stress, and most of the time we respond automatically to the stress cues that our body and mind sends us. Our body is created in such a way that when you are stressed, you don't even need a therapist or I don't know, to tell you that you are stressed. If you know yourself very well, we all know ourselves, our bodies, and how they work and how they respond. So when we are stressed, our body tells us, we get the mental cues, we get the signals that we are stressed. And so when you get those signals, it is important you take a break. For the sake of your mental health, you take a break. If you are passing through maybe serious issues, you know, take a break. If you understand that your mental health should be number one, should be of topmost priority in your list of things that you prioritize, then you should not joke with your mental health, and then you should know when your stress level is exceeded. Stress is good and stress is bad. We have the good stress. The good stress is needed for you to be able to perform optimally. That's to perform your best. For example, when you're working towards maybe a deadline or playing sports, you know, when you're working towards a particular thing, that's what happens. You have to stress yourself to be able to meet up with the target. Then we have the bad stress too. The bad stress is when you walk around you know, that's the problem. That's the problem with when something is actually free. Dorcas. Hello, Dorcas.
Yes, ma'am.
Yes, ma'am. Noise from you, please.
Yeah, like the people around, please. But I'm moving away, madam. Please.
Please, I beg of you.
Madam, hello,
yes,
madam.
Yes. Please move away from there. Thank you.
Please do that. Okay. Do that, please.
Okay, sorry about that, please.
All right.
Disturbing the rest of us.
Sorry about that, please, madam.
Oh, sorry, please, dear participants.
Okay,
sorry for that. So we have the good stress and we have the bad stress. Now the good stress helps us to function optimally. Then the bad stress, there are people that they are see, our body is just, I want to now move a little bit out of, I don't know if I should be doing science. I'm always passionate about mental health. Now our body is such that it's just like an elastic. For us women that wear skirts in those days of underskirts that have elastic or clothes that have elastic. Now, an elastic has a limit of elasticity. It has a limit that it cannot exceed. That's how an elastic is. So that's how a human being is. When you get to that, your limit of elasticity, when you pick an elastic and you stretch it so much that it gets to the air, you see you cannot get it back. It's difficult to come back. So that is practically what I am saying. So don't let yourself get to that limit of elasticity. When you know that the stress is beyond your limit, please step away from work. Those of us that like work. Yes, it's good to work. We need to put food on our tables. We have to be financially independent. We have to take care of our families, of course. But know that we need to be healthy, be able to do that. I still repeat because I've said it here before. So bad stress can sap your energy. It can create, I didn't put those on, it can even give you sicknesses. It can bring other illnesses to you that you don't bargain for because you have exceeded your limit of elasticity. So it is important that we I'm struggling. I want us not to exceed 8 o'clock. I pray that we don't exceed the time because with all those disruptions and being for the fact that we didn't start on time. So now there's something we call the stress curve. You can see the stress curve. Now, before I talk about the stress curve, just maybe 1 second, I want us to understand that stress itself is an emotional and physical response to pressure from the environment or internal sources, things that we do is a response to them. So when you are working, you take note of that, your optimal level, optimal performance, like you can see on the stress curve. You can see from the low, that's when maybe you work, no motivation, you are less motivated, you know, there's no stress, you are just there. You keep moving from the low level till you get top. You can see that guy there at the very top. That's the optimal, when the person has performed, that's optimally. That's the optimal. When you get to that point, automatically, your productivity diminishes, just like this curve we are seeing, it slopes, because you are a human being. You understand? Because you have exceeded that limit, you become anxious. You become anxious, and then you will not be able to perform maximally as you should perform. So what the summary, the A to Z of this is, just as you move from the beginning, you keep stressing yourself, and the stress gets to the peak. Please, you need to rest, because if you don't rest, no matter the work, even if you are going to submit the work to, I don't know, Queen of England, or I don't understand the importance of, you will definitely, your productivity will definitely diminish. And do not forget that in mental health, since your mental health is of priority, you cannot exceed that level, just like an elastic, because you will break down. It's only normal. You will fall, you will break down, because we are humans. So it is important. So let's see. Let's see. Acute stress reaction occurs when symptoms due to a particularly stressful event, usually a severe traumatic event. Now, we are all human beings. We are faced with different things, different mishaps, different incidences, different from our backgrounds. There are people that they are having post-traumatic disorder. Maybe they are passing through, they were raped. Pardon? Are you saying something?
I think it's a background noise. It's a background noise.
All right. Okay, because I said I can be stopped at any time. So I thought someone was asking a question. So as we were saying, some people, for women, you know, women can relate more, because sometimes in our lives we are affected by, you know, we are always women. Most times, I don't want to be gender sensitive on this platform, but women are most times at the receiving end of something. Women are at the receiving end of something. Sometimes you see a girl that was maybe raped when she was small. That's an experience, maybe raped at a tender age. And the worst still, you are raped, you are being tortured, you are being molested every time. You keep painting that picture. Even when you grow, it takes the grace of God and a lot of work to be able to, for you to be able to come out of such situations. And not only rape, different things. The list is endless. Different things we will pass through, not only the women folk this time, even the male folk. So many things affect, even people in the military, maybe that fought maybe the war, like my late father fought the Biafra war, you know. So most times it took a very long time for him to be able to, even till he passed on, he was still having some of those flashes. He was still having some of those. He has those post-traumatic disorder. He had the hangover of all those things, you know, that happened. So acute stress reaction, the symptoms usually develop quickly over minutes or maybe hours, but usually settle fairly quickly within days or weeks. You see, because most times these things are as a result post-traumatic, as you pass through the trauma already, but it keeps coming, it keeps flashing. It can be maybe over minutes, maybe hours, and maybe you feel you have gotten over it, but it can reoccur. So these are some things that we have to take note of. Now we can see some symptoms like anxiety, low mood. These are some of the symptoms. Avoidance of anything that will trigger memories. Remember, I told you that maybe somebody that has been raped, in as much as or someone that has passed through fire, maybe fire has seen fire, or maybe I've been in the house when the house caught fire or something, such experiences. You see that kind of person it will take time for such things to live. If as much as someone scratches a stick of matches, you know, a matchstick, and the person sees fire, can as much as flashback memories
of that incident of the fire. So these are things that is just like I had a friend in school, you know. I said I'm a woman of many sides. I've seen the good, the bad, the ugly. I've seen the big, the small. So I have, when I go for trainings, when I have trainings, I just make it real because I express the things that I've seen. Maybe that's why I try to do my best when it comes to training, because it just comes out because I remember things. Now there's this my friend that was actually, the house was actually burgled and they raped her. You know, thieves, armed robbers came to the house at night. They banged on the door. Boom, the house is the door is this iron door, very hard. They banged on the door. They banged on the door. That is, you can imagine the terror and the fright. They banged on the door, the noise of the banging. The door, they were able to break down the door. They entered, they took away what they wanted. They did all the things they wanted to do, and they left. That lady, I'm talking about something 15 years or 18 years ago, if not even more. But up until now, even she comes around to visit you, this particular lady, even if she comes around, like she's come around to visit me once around my neighborhood, they were trying to weld something. And the noise, like they were hitting and hitting. You know that alone traumatized her, it brought back memories, and she was scared. She just, before you know it, she started shivering. I was like, Tope, Yoruba lady, Tope, what's the matter? She now said, why are they doing that? Why are they hitting that? Why are they sounding? She was so scared, shivering. So I had to, because we already know her, that noise, when there's any noise, anything that looks like banging of an iron, it terrifies her. So you see what can happen. You see how people get affected by things that happen around them, by things they have passed through. So these are some of the things that brings memories, that brings acute stress reaction, aside the the person can raise the price for that person to get the time. Okay, we also have symptoms. We have the which has, do you know someone is having this anxiety disorder? We are back to anxiety disorder. You know, how do you know? Because you see something, the person can avoid places, situations that they believe could trigger anxiety. You can avoid social gatherings or public speaking. In fact, at a point, I tried to avoid, since that thing happened to me, I talked about the presentation that I was anxious. I avoid anything that will give me, at least for 2 years, until, because of my profession and because of what I do, I don't have a choice. I had to break out of it. I had to overcome it by whether I love to do it or not. Because I was, by virtue of what I do a lot of presentations. I go to schools, give mental health talk. I do trainings online. Not only mental health, I do project management, I do caregiving. So I'm a woman of many sides. I do a whole lot of these things. And there's no need for me to continue to be having public stage fright or anxiety disorder, because it would not even help me. So I broke out of it. So behavioral symptoms, you have all those restlessness too. You see, they become restless, fidgeting, hold the paper, like it happened to me that time. I forgot to say that. I was holding the paper, even the slide, the paper was shaking on my hand. And before you know, the paper fell on the floor. My dear, I mean, let me not say my dear, but my dear participants, I tell you, it's something that I don't even wish my worst enemy. But thank God I have the right knowledge and I was able to overcome it. So what of people that don't know what to do? What of people that cannot overcome it? You can imagine how it would affect their lives in future. You know, so procrastination, such people with these issues of anxiety can procrastinate. Oh, I'll do that. No, how I wish, okay, I won't do my own today. I won't give my presentation today. I'll give it tomorrow. I'll make my presentation tomorrow. They keep procrastinating. Why? Because of the fear of facing the crowd, because of the fear of doing what they feel is challenging. These are some of the things that we need to do. We also have the physical symptoms, of which you can see all over. The sweat, you can see the shaking, you can see physical that I have the knowledge. If I see someone that is anxious already, I don't need a magician to tell me. I already know. Physically, I already know. And psychologically too, psychological has got to do with the internal experiences that a person is affected by the thoughts, the emotions, psychologically, what the person thinks, excessive worry, persistent, uncontrollable worry about certain aspects of life, my work, every time my work, my health, my relationships. Why is this man treating me like this? Why is my husband treating me like this? Or why is my wife treating me like, women, our own? Why is it that things easily get to us? And not only women, everyone is affected by mental illnesses. When you begin to look at all these things, rumination, repeatedly thinking about distressing situations, and so on and so forth. This one has got to do with the psychological, that's the symptoms, psychological symptoms. It deals with our psychology, with our sense of reasoning. So like I said already, behavioral symptoms, you can see it there. Distress in social situations, avoidance of certain things, increased substance abuse. Remember that I said that I had one friend that would have to drink well to be able to face a crowd. I don't know, I've lost touch with her now. I don't know how she has been able to cope with that, because we went our different ways after we graduated. So that is practically it. So physical symptoms, cardiovascular, flushing, palpitations, chest pain, cold hands, respiratory. In fact, that time, it will seem as if you cannot even breathe. For those that have experienced it, you know what I am talking about. So all these things put together are symptoms that you can see and know someone is having anxiety issues. So, and then anxiety too can affect our confidence. When you are anxious, when you are overly anxious, it affects your confidence. Like when I had the anxiety issue, I like to make reference to myself because I understand it better and I can tell you how it is. So anxiety, it made me, I wasn't confident. I mean, this is something I went through that even in my sleep, you wake me, I can talk about it. All of a sudden, because of the people I saw, because of everything, my system suddenly went upside down. I now developed elephants, not only butterflies in my stomach. It attacked my confidence. And the thing I was thinking I'll be able to do easy, I couldn't do it again. And when you begin to feel less confident about a particular thing, you try to avoid that thing. And because you avoid it, you feel less confident. When you feel that you cannot do something, you will avoid that thing. By avoiding it, is it the solution? Of course not. It's not the solution. So confidence can be regained by learning how to cope better. I remember that time, thank God for those people that have educated parents. Like my mother told me, my first public speaking I did in secondary school, my mother told me, she tried to mentor me. She told me, this is what you do. In fact, when you get into that hall, don't look at people's faces, because if you look into the eyes of people, they may try to do one or two things there, Someone can squeeze the face, someone can do, especially if you are dealing with students your age, they can play pranks on you. So if you feel that you are tense, you can look directly. If it is a hall, it will seem as if you are looking at the people, but of the truth, you are not looking at, we are looking at the extreme end of the hall. So there are many things you can do to ensure that. Take a deep breath, breathe in air, take in enough air, and send it out. It gives you a refreshing. There are many things you can do. Really, there are many things you can do. So if you have those issues and it is prolonged, then it's an illness. It's only when it is in the peripheral, in the surface, like I talked about my own mental health, my own anxiety challenge I had that day. I had the presentation. Ooh, that one happens to anybody. But when it is persistent, when you grow with it, when it takes time, and you're seeing the same thing and you're not doing anything about it, of course, it should give you cause for concern. So now there's what we call the Goldberg Anxiety Scale, like we have here. So because, like I said, this is not a mental health, it's not a diploma program, it's not a master's program, it's a certificate program. Yes, but if you want to, like Mr. Dafe, that, and any other person that has not said, if you want to really delve into it and really go into its properly, mental health, then you have to go further to gain all the knowledge. So Goldberg Anxiety Scale, in this, now you get to see how you can assess yourself. You can just do a little assessment so that you know whether you actually need to go and see a specialist, a professional, because you cannot still conclude even after doing this. And this is an anxiety scale. These are questions that you can ask yourself. You can ask yourself, these questions and then answer them. You ask yourself the questions and then you answer the questions, you score yourself. It's just something you can do. of course, you definitely get the slides as MJB does. So like when you score yourself, score each 1 point for each. If it is a yes, you score 1 point. For instance, have you felt keyed up or on edge? If it's a yes, good, then you score that point for yourself. You put a yes. So you give a yes, you give a no. So at the end of, some people have some of these symptoms, and the average number experienced by African adults is 4. So you look at the percentage, the higher your score, the more likely that you will experience a disruption in your daily life. That is how you can, that's just a little assessment you can do. But of course, if you check all these odds, the final solution is for you to see a practitioner, a professional, not just you assuming. You have to go a step further to see a practitioner. So anxiety disorders now develop from a set of different things, like we see, from genetics, brain chemistry. If you have parents that already have anxiety issues, then disorder, that they have the disorder this time around. So you have to know that anything can result in that. You can have that particular anxiety issue. That's to say, it can be genetic, it can be in the gene, it can be transferred from your parents to you. Good. And there are also other things, personalities, life events, things that have happened to you, trauma, and so on. So these are some of those things. And anything that sparks your flight, fight, or freeze. What do we mean by flight? Naturally, if something happens, if you see a lion on your way coming back, God forbid, from work, or you see something scary, the first thing your brain will tell you, the first thing that your brain will tell you is that, you see it, I either have to take off or you stand and face it. It's a clear thing. That's the meaning of flight or fight. It's a syndrome, or it's a terminology, or there are terminologies that are used in mental health. That's when you go further. If you want to advance in it, you will understand it better. But this is simply self-explanatory. If you are faced with danger, do you take off? Do you stand and fight? Or do you freeze? Do you just pretend that all is well? Do you just pretend and don't respond? You just freeze, like if something freezes. These are some of the things. So when you face threats, anything that sparks these things I've talked about, that tells you, that your brain tells you, run, fight. Why are you doing this? No, I cannot take it. And you want to, you want to fight. Or the freeze, all these things put together sparks anxiety, makes a person naturally anxious. So, so these things may cause anxiety symptoms, cumulative stress, like we talked about stress, low self-esteem, trauma, so many things. Oh, trauma, I don't even want to talk about it. Trauma is something that if I want to talk, will take us the next 1 hour. So trauma, people go through a lot. Oh, people have real problems. Dear participant, people have real problems. So when you see people, or when you have issues, do not think that you are alone. Do never you think that you are alone. Know that it is something that can happen to anybody. Feel free to share. Feel free to share. When you see people have depression, since you have this knowledge, please go to them, talk to them, try to help them. Try to help them. Don't stigmatize them. Don't do as if you are more important than them. Oh no, don't treat like that. Don't treat them like that, because nobody actually knows. These are sicknesses, like we talked about the prevalence. There are things that we are sure that they will happen to that they take note of. Respond to immediate crisis. Show respect to persons always. That's very important. Engage and talk. When someone tells you I'm having depression, don't say, oh, that one is not my business. Or depression. What kind of sickness? That means you're a witch, Jesus. Are you? No. Show empathy. Show empathy. Like I said, I am currently running a caregiving training, a professional diploma in caregiving from BCC UK, and I try to emphasize the importance of empathy, that you can't do these things if you don't make the humanity in you come out. You cannot help people that have these things because the society is so attacked. It is difficult. You find few people that really want to help those that have it. Even if it's your family members, even if it is your colleagues, you can, like you've observed, that it's not just a day of being depressed. It's a continuous thing. That person is withdrawn. He's not happy about life. He's seeing the world come. He's seeing everything at odds against him or her. What can you do? This is what we have talked to. Assess the frequency of the problem. When you take the person to the appropriate quarters, to the specialist, they would assess the frequency of the problem. Respond to immediate crisis. Show respect to this person always. At no point should you try to belittle the person or make the person feel less of a human being because of the condition. Even if it's your child, yes, you are the mother. Like we have some children that maybe actually go to abuse drugs or do this, and their parents, instead of understanding, taking the empathetic part, helping to see how to help them, they in turn use the other, bring out the rod and use it on them. That way, it's not going to work, because you won't know till when such children will go ahead to go and do something that we'll now hear in the news later. So engage and talk. Encourage the person to seek help or self-help strategies. Encourage the person's mind of the fact that, oh, when you go, people are like, no, let's interfere with recovery. There are things that can interfere with recovery. That's what now, comfortable. Maybe someone that is on drugs or something, the behavior is comfortable and to change. The person wants to remain at his or her comfort zone. Just wants to be comfortable. Okay, I agree. This is what's happening to me. No, they are comfortable. And it provides a feeling of safety or security for the person. If what you are trying to do, the person does not see it as being wrong. That's why you have a lot of work to do. If you want to help, because the first way of helping a person is the person realizing that he or she actually needs this help. That's one thing. So lack of awareness too that anything is wrong is another obstacle. It can interfere with the person's recovery or your help in wanting to help this person. Also, avoidance of specific situations leads to increased anxiety in the long run. Continuous stress. These are obstacles. These are things that can interfere in the recovery. Even when you try to help this person, or maybe this person is being helped, the person can stand as bottlenecks on the way for the person to be helped. So, but nevertheless, you still have to do what you have to do. So anxiety disorders are very treatable. Yes. Only about 1/3 of those suffering access treatment. They are treatable, but the fact is, do we actually have this treatment? When I started, I told you that just like in Africa, it's just 1% of them. They not have the means, they may not have the money, they may not have what it takes to actually see a therapist, to actually see a mental health specialist. They may not have it. That's why this mental illness is really affecting low-income countries. It's why in countries don't even prioritize. They don't even see it as important. They don't even prioritize. They don't see the need for them to even take it seriously. Maybe they actually to okay. We've had a fluctuation of network once again. So please let me share the screen. We'll almost be done. We don't have too much left. So much work to do. So at this point, cognitive behavioral therapy is also important. Treatments, ways of cognitive behavioral therapy, those of us in the business management of stress too. If you're able to manage, you help manage the stress of those people. It goes a long way, you know, in a, excuse me, in helping everything. So when to refer to a general practitioner or a counselor or a primary mental health or the primary mental health team, when do you think you should refer them to? If you sense that the person is suicidal, the person is having suicidal tendencies, please let's pay attention to this. Many people that have, I get to hear maybe in the course of my trainings, people say, and I didn't even see any sign. We didn't have any sign. I didn't spot any sign. The person will end his or her own life. I say, no, it is a lie. I always disagree with it because before a person actually gets to the point of committing suicide, if you are observant, if you have the right knowledge, you would have seen when the person started seeing the emptiness of life. You will observe when the person started losing interest in the things that naturally used to be interesting, especially if it's a family member or a loved one. You will sense all these signs. But the fact is that we will just overlook them, or maybe our spirituality comes in, we just assume that, maybe he's being attacked, or maybe it's this or is that. I agree, I'm a spiritual person as well, too. So some things we just don't read the signs. That's it. The signs have always been there, but we just don't read the signs. So when the person is depressed, like having clinical depression, and it gets serious, when the person is showing signs of severe neglect, that sometimes you see the person is being neglected, or the person himself or herself neglects themselves because they're just tired of everything. They're just tired of life. They're just tired of everything. Please, are we together? Can everyone hear me? Hello, can everyone hear me?
Yeah, yes, ma'am.
Carry on. Talking to myself. Was talking.
Yeah, no. We are with you, ma'am.
A person talking to himself or herself for this long. All right, thank you. Was talking to yourself. Okay. Is or talking to herself for too long. It is signaling a form of mental illness. So that's why I was scared when I didn't hear anybody. I say, have I been talking to myself? I need to check myself. So, well, that's on a lighter note. So, yes, it is true. So if you have someone that you see the person sit down, talk to himself, or I've been on this platform talking for more than 30 minutes to myself, and I suddenly realized that I've been talking to myself, then I need to see a mental health specialist that is higher than me and that is more knowledgeable. So let's go to the next one. Other interventions, like we said, what can you do when to refer? We've talked about it. Make sure the person sees a counselor. Make sure the person sees a psychologist. Make sure you look for help. Please and please and please. This training, the beauty of it is that you just learn these little things. You may not want to be a mental health specialist, but just look for the signs. Just ensure that the people around you see for your loved ones. Just keep a tab on them. You may never know. People go through real problems. And when they are like that, no help comes to them. Nobody, they don't see a shoulder to lean on. They don't see anybody to talk about. They cannot overcome this stigmatization and their minds and share their experience.
Ana mun mai asaran dan guntun data da yake da shi. Bai. Zoom meeting ne wani training ne akan mental health.
Finally, sorry, I think we are getting to the end and the network is actually trying to in transmission. I wasn't hearing anyone and I think we had network issues. So as I was saying, finally, this is the last slide for today and I plead with network to permit me to end. Let's end it in well. So the last slide we have for this evening is suicide. Suicide. Okay. Before we talk about it in the next few minutes, I assure you that before 8:10, 8:15, we'll be out of here. Before I continue, please, I'd like us to looking at suicide now. And the suicide is something that has really been very rampant. The prevalence is in the increase. Like every day we hear this one committed suicide and this one committed suicide. In your own opinion now, I want to ask those professionals, knowledgeable professionals on this platform, what do you think are the reasons that we are having? Can you give me some of the reasons you think we are having the prevalence in suicide, in suicide often? And don't forget, I want to build a cast. This, I would like someone to talk before I continue to. Who is going to pause? Just maybe one or two reasons you think that we've been having suicide in the Oh, Jesus. Please, are we together? Okay, I think I should just move, instead of the questions, I should just move into it because network is actually trying to be funny. It's been favorable since. Don't know why. So needless to waste time, I wanted us to share our experiences, but is anybody willing to?
Ahora banar na tambaye ku ba? Ba na biji bane. A yau na sa ku bane. Ni ne mai kai, a don ka zama wa biji. Har yanzu wani. Ina tsora hannu ya wannan kan da. Ya hankali. Ana zo miki nuna asaran guntun data na zan yi.
Hello, admin. Is it possible to mute everybody? It's getting distracting now. Please, just mute. You have the power to mute it. Please. Except all of us are not part of this program. Please, I believe that admin should be at alert now. So any external noise like this, you should be able to mute it immediately.
All right. Well, okay, let's move. So, okay, it's obvious no one really wants to, or maybe we should just go ahead. So we're actually talking about suicide. I don't know why today's training network wants to start at this end. We are almost done. So suicide, we've been having the issue of suicide being in the increase every time. Lately, the prevalence is very, very high. So what can we do about it? Let's just move, because we would have rubbed minds, but let's go. So a death is classified as suicide by a coroner based on the evidence that a person died as a result of a deliberate act to cause his or her own death. So that's suicide. Just not anybody found anywhere is assumed is attributed to suicide. It must have been proved by a coroner based on evidence that this person actually ended his or her own life. It was a deliberate act by the person to end his life. That's only when they can say suicide. And because so when we see people with suicidal ideations, then it is very important that we do something about it. You know, when you get to see that before someone actually commits suicide, it takes time. It starts with an idea, or it starts as an idea in the person's head. When maybe depression has metamorphosed into the state where the person actually wants to end it all, you know, evidence also suggests you see certain things. If sometimes these ideations could be associated with clinically significant symptoms of depression. Most people that end their lives, like we talked about, it's been one of the major causes of suicide, is from depression. When it starts small, they don't do anything about it. Their loved ones don't do anything about it. They don't talk to them. You find out that at the end of the day, the extreme adverse results of not handling this depression and maybe schizophrenia and maybe bipolar disorders and all these other mental illnesses, the end result most times moves towards suicide. So before a person actually commits suicide, they have that suicidal ideations. You see the signs, like you see the handwriting on the wall. And if you can read the handwriting on the wall, then it will make things easier. Regardless of what network is trying to do, just be rest assured that you will get the slide from MJB Management and Integrated Services so that you then know what to do. You can go through them because network is trying to be funny. It does not even allow me to reach 8 o'clock, and today's network is not so. So let's look at the groups of people that are affected. Groups of people, adolescents and young ones, people experiencing mental illnesses. We are looking at the group of people that are affected, that are prone to the risk of suicide. People experiencing mental illnesses, men, like I kept stressing men because they You know, when it is too much, the pressure is too much, I cannot feed my family, I can't take care of my wife, I cannot do this. And some of them may tend to have suicidal ideation. So lesbians, gay, bisexual, because of the whole issue that is attached to this particular sexuality in especially Africa. So it's that alone can affect them. They can result to ending their lives. People that are bereaved by suicide too are prone to, they'll be like, oh, if this person I love so much has ended it, what am I waiting for? And so on and so forth. So what you can do, emergency service personnel too. And we also talked about the military, people that are exposed to violence, either at home, at their workplaces, or in the community, people that have seen real violence, like have been maybe involved in killings, people butchered, people, you know, all those things. They are easily, those sets of people are easily exposed to having suicidal ideations, to actually committing a suicide. So this is very, very important. Older adults too, and adolescents and young adults. This is why, by virtue of the work I do, we move around schools intermittently, to give a talk to adolescents, give talk to people, even in the universities, core members. We talk to them because they need their ages, so many things. They are still secondary school ones, they are still trying to find their feet. They are still struggling with so many things: academic pressure, peer pressure, to go into drugs, to do this, to do that. All those things can affect them. And you see, they may not decide to end it off. Educating this particular set of people, or those people that are prone to having this risk, it's very important to help us to nip this suicide rate from skyrocketing, nip it in the bud. You understand? So if we can talk to them, educate them about mental health, stress management, how they can manage stress, and suicide prevention is crucial to save lives. It's very important. So if you can have, even in your own little corner, the little you have learned, you have a child, you have a friend, you have a colleague, anybody that is passing through these challenges, all you need to do is to see how to help. By talking to them, let them know that it's not the end, or let them know they are not alone. People have real problems, so it's not enough for you to live your life. If you don't have food today, doesn't mean you won't have food tomorrow. You know that suicide is never the solution. It's never the end of it all. You know that life is not a walk in the park. So you are bound to have this bottleneck, bound to have all these things happening to you. You know, it's not all rosy. So if you can see how to, you know, talk to reach out to those people, it will help us a great deal. Let's look at the statistics now. Yeah, you've seen it there, that according to World Health Organization, the rate of people that actually commit suicide is very high, and the highest rates are observed in the ages of 15 to 29, 30 to 49. That's age brackets. They are, because 15 to 29, like I said, they are the ones that are really trying. This age group is very vulnerable. 15 to 29, they are vulnerable due to the significant physical, emotional, and social changes that they experience during this developmental stage. So sometimes that's why you have a child that is within this age range. Don't just leave them. Don't just say, oh, it's not an adult, it's above 18, at least it's up to 18. Should be. No, don't leave them. Whether they are with you or not, keep a tap on them, because so many things go on. Peer pressure, academic pressure, things can be going on with them that at a point they are not able to contain with it again. And they don't have the right people to meet with them at the right time and in the right places and conditions to be able to make them understand that these things are normal if you can go about it the right way. You know, so they just feel that, why am I here? Let me just end it off. You know, so you can see like having 19,000 suicide rates per year in a country. 19,000. It's choking. It's like in Nigeria, every time I go through the news, the other day, I learned of a lady that they said because her husband left her to go and marry a lady outside, or traveled out and abandoned her, the children and everything, she now decided to commit suicide. And I was just saying, oh, how I wish I knew that kind of woman. I know maybe I wouldn't have been able to do anything, but I would have told her something, that now that you have committed suicide, you have even given, like, will I say, the license, you've given them a blank check, that this is a blank check, fill it in. You've given the man the blank check. That's to be free with his life. So you've ended yours. Everything about you has come to a halt. So sometimes we just need the right people. Sometimes you just need the right push. Sometimes you just need the right knowledge. And you need to keep your ears to the ground, be vigilant and observant, so that you can help when people have this issues. Your son can come back and tell you, Mommy, you observe changes in him. You know it's not the son you used to have. You know it's not the child you used to have. And you see, you observe the signs and red flags. What do? You spring into action and do something about it. Don't let it degenerate into suicide. There are ideations first. There are ideas of attempting suicide first before it definitely gets there. So if you can nip it in the body in the process, then suicide will not be the end of it all. You know, so I would have really loved us to talk about this, share our experiences, but to be on the safe side, I think we should try to see how to get it done before network just puts us off totally. So you see warning signs, like we've talked about the population. So what's just on this particular graph is the population graph, which we've already talked about, like the age group that is prone to having suicide. Is what is on that graph. You eventually have the slide. So warning signs, you see a suicide plan of what they intend to do. You see somebody can practically say, oh, I've had enough. I'm just going to kill myself. And you just laugh and say, please move away. You're talking, can you even kill yourself? Or you just call it a bluff or call the person's bluff and you move. Before you know, you hear that something has happened to the person. Will you ever be able to forgive yourself? Of course not. Somebody like me, I will never be things that are not normal. You understand? When you see handwriting on the wall, please do something. You see dramatic changes in mood. You see depression, withdrawal from friends, keeping to themselves, availability. And such people, make sure that you do the needful. If you have a child that is always prone to say, I'll kill myself, I'll do this, of course, you should not keep that child in a place where the child will have accessibility to things, to weapons that can help him or her to end it all. You are not, as someone that has this knowledge, keep things away from objects that keep things that could help him or her to actually carry out the act away. I've had a person when I was in police college. I actually attended police college for some time. We had a girl that her father was a policeman that lived in that barracks. This girl, because of the beatings and the problems the husband and the father and the mother has been having, it affected this girl so much that everything about her was affected. And she actually wanted to kill herself. And you know, her father was a policeman. So it was very easy for her to pull the drawer and remove the father's revolver. And she ended her life. She has been having those ideas. She has been harboring it. Yes, but she didn't know how to do it. But when she was having those ideas, the weapon she actually needed and how to go about it was very easy because her father was a policeman, and the father's drawer. The father never had the faintest idea that a child could get to the drawer. She never had the faintest idea. I mean, he never had the faintest idea, but what the child ended her life using his weapon. So that's one of it. So writing and drawing about that, you may have some children that cannot really express themselves. They may go into their own shell. They'll be drawing pictures of death. They'll be visualizing how to kill themselves, maybe attempting to even kill themselves, but they don't know how to do it. So they are doing more research and finding out how easy it is to kill, to end it all. And you are there, you don't really understand. So please, let's be very concerned about this particular aspect and all this training. Let's be very concerned because the prevalence is skyrocketing. It's not funny anymore. You know, isolation from all types of support, family problems, these are things that could be warning signs. Rage, anger, seeking revenge, you know, no reason for living, no sense of purpose in life. These are reasons that somebody can. And when it gets to a point where someone sees the emptiness of life and says, why am I even alive? What's the need for me to be alive? Let me just end it all. There's no money to buy food for my children, my family, my this, my that. Please, men. Because even statistics has even told us that men are more prone to suicide than women. They are more prone to suicide. So please, men, take it easy on yourselves. Really, really, really. Take care of your mental health as well as women, because women also are at the receiving end of things. So when it comes to their own, we know what most women do when they need to, when what makes them feel so bad as to want to end their lives. But I thank God for awareness, you know, we are beginning to know it. So what are some of these protective factors? Connectivity to your family, responsibility for children. If you are a good mental health specialist or like someone like me, what I normally do, like I have a friend that many times told me that she has attempted severally to commit suicide, That the only thing that stopped her is that she doesn't just know how to go about it, that she does, and she knows that in the military, because then we're in the barracks, that if you are caught, you are attempting to commit suicide, it's better you even commit a suicide in the military, in the barracks. Because if you don't, if you are caught in an attempt to commit suicide, failed suicide attempt, you are going straight to appropriate quarters where you can commit the suicide properly. You are going to that appropriate quarters. So the woman, that was the only fear. She said many times that she tries to go and hang, she even tied the rope, but she does not know whether to put it, how to put it in such a way that she doesn't even know. So you see that people have, so when she talked, I now told her, told her that, what about your children, your beautiful children? I made her to see those things that are dear to her. I made her to learn that connect, because she was a person that really had good family values. And I knew that attacking it that way, she will see that, yes, that I need to be alive for my family, for my children. Because if I end it all, even another woman will come the next second and will take these children and will maltreat them, and my efforts will be futile. So is it not better for me to stay and take care of these children, you know, or to leave, divorce, get out of this marriage and have a fresh air to breathe and live my life than me killing myself and ending it all? I made her to see that ending it all is never a solution. In fact, it's the beginning to another problem. The beginning of another problem that you will not be there to face. So these are some of the things. So you know the aspects to follow it up. If it is a child, you know the vulnerable parts of everybody, especially if it's a family member, you know those things that will really get at the person, that will make the person drop his or her resolve, and so on and so forth, you know. So these are practically some of the protective factors, you know, that you can use, that you can help in the course of you trying to see how you can help someone suffering from a mental health issue, or someone that is attempting suicide. Now, a sense of meaning and purpose to life. Okay, we've already talked about that. Community and social integration. Try to see how to talk the person into being with people, being in the midst of people, smile, being happy, you know, relating with other people, you know, knowing that other people too have real problems. You are not the only person that your husband cheated on you, or your wife is cheating on you. You're not the only person that you don't have money to pay your children's fees. You're not the only person that was raped when you were young. You're not the only person, and so on and so forth. Know that people have real problems, and suicide is never an option. It's never the solution to any of such things. Good. So we also have social and economic factors that influence the suicide rates. I beg your pardon, suicide rates. So, and what are they? Economic depression in our country, in Africa, in the world, globally, you know how it is now, you know how hard things are. So people may, in a bit of not wanting to withstand what is happening, they may want to end their lives. Yes, once again, it's almost 8 o'clock. We are almost done. Just a few slides. So, because network is not very friendly. Please, are we still together? Can everyone still hear me? Please, I need to know. I run down.
Yes.
3 slides.
On the right part, please.
Are we together? Please.
On the right part.
Because I needed to know. Sorry, I have to move like that. Normally, I don't like to move with speed, but I have to do it. So network does not cut me, and I'm not done with this training. I wouldn't be happy. So as I was saying, these are some of those things that can influence suicide rates. Media presentations of suicide, rates of marital breakdown, like I've talked about. Please, husbands, I know this is not the right forum. Please, wives, anything that tampers with your mental health, break free. Whether you are a Muslim, I don't know, because I don't know the Quran, I'm a Christian, but the Bible says, if your eye makes you to sin, cut it off. So in this case, let me tell you that if something gives you sleepless nights, something attacks your mental health, that your husband cheated on you. You know why I keep making reference to that? Because most of the issues of women committing suicide I have seen is my husband married my friend. My husband ran away. My husband left me and my children. And a woman, beautiful women, just end their lives like that in a twinkle of an eye, committing suicide. Or men too. It's not only women, it's men too. Oh, my wife did this. Or my wife is doing this. Or my wife cheated on me. Or a woman I spent so much to marry left me and now went after my friend, and so on and so forth. So many things are happening. There are so many things going on in the world. So with all these things, rate of marital breakdown, please, anything that will affect your mental health, oh my God, just let it go. let it go, because your mental health is more important. If you get mentally ill to the extent that it cannot be handled, for God's sake, you'll be kept in one corner and life goes on for everyone. Even the people that you feel that are dearest to you will still move on. So that's it. It's a personal thing. We should just know that suicide is never an option, no matter what you are going through. Suicide is not an option, or it is not the end. You can still make it. If you have the positive mindset, then you can move. I know things are hard. Economic change, availability of lethal methods of suicide. Some people even Google it. Google it to see things that can end life, lethal methods of suicide. How can I just end? Let me not use, maybe I just take it, I don't want to mention, so that someone will not say I heard on this platform what I can take from suicide. So I will not say, there are certain drugs like that, that you can take. The media presentations of these things, rates of marital breakdown, the society, our culture, the rates of psychosocial disorders in young people, so many things are influencing suicide rates. So we shouldn't be ignorant of these things that happen. So suicide risk assessment too. If you are concerned about a person, undertake a suicide risk assessment. Assess if the person is having suicidal thoughts. How can you do that? Ask the person, whether your friend, whether your colleague in the office, you observe these things and you say, this person is degenerating, you did not act fast. Ask the person, are you thinking of killing yourself? Are you having thoughts of suicide? Don't mince words. Ask them directly. You understand? Just go ask them. Because if you are close to the person, will say, I just need to end it all. I've been thinking of, just like that woman, I've been thinking of killing myself. You could even ask, do they have a specific suicide? Okay, in what ways have you been thinking about killing yourself? You find someone that is trying to commit suicide, you see someone that you want to help. Please, on no account should you judge the person. On no account should you look at it in the other way. Try to look at the person in an empathetic manner. I know what you feel. But remember that we all have real problems. You are not the only one. Don't say, you want to kill yourself. Okay, go and kill yourself. Or you are just being silly. Maybe you are just being silly. Every time you talk about killing yourself, talk about killing yourself. Please, I don't want to hear that. If you like, kill yourself. Or I know you are not just serious about it. Or you just take it, call it a bluff. Please do not. Because I tell you, I don't have time to tell you stories. But if I have the time, how I wish I had till 10 o'clock to talk here, I will not stop. I will talk inexhaustively. I will talk and you wonder what kind of woman is this talking without break, because I have seen it all. So you can ask. Don't take anything for granted. Don't take anybody's moody situation for granted. Try to ask. Be empathetic. We are humans, for God's sake. You ask the person, have you taken any step to get the things you need to carry out your plan? Ask. Ask the person and try to break even. I know sometimes it's not a walk in the park. Some people are very reserved. Some people will not want to share it with you. But I tell you, if you do it with love, if you do it with the right knowledge, and if the person, you cannot break through to the person, please don't take anybody's suicide attempts. Don't call it a bluff. Seek appropriate quarters. You can call emergency. You can report to a mental health specialist. You can just do something. If you cannot break through the person's reserve, just do something, so that you don't regret later and blame yourself all the rest of your life for not having acted when you should have acted. Now, risk can be increased if the person has been drinking or using drugs, and if they have a history of suicide attempts already. There are some people that have had history of suicide attempts. They've been caught attempting suicide severally. So such people, don't joke with them, because they may decide to finally actualize their ideations to make it come to pass. And such people, you have to know, have you tried to kill yourself before? If you just see someone that you're trying to help, find out, has the person been using alcohol or drugs? What is actually putting the person in this situation? Do what you can do to help that person. Now, take all talk of suicide, any specific plans. Somebody just says, I'll kill myself, and the person doesn't have any specific plan. Don't just take it like that. If the person is consuming alcohol or drugs, try to stop them from using anymore. Try to ensure that the person does not have ready access to some means to take their lives, like I already said. Like that lady, like that girl took her father's pistol in the drawer and ended it all. Before they could say Jack, say Robinson, it was too late. So when those things are there, it's readily available for them to do what they want to do. If the person has a weapon which could be used to injure themselves, or a person is becoming aggressive, please call the police. Don't, at a particular point, break all protocols. call the police, reach out, help that person, because life, there's nothing as important as life. So don't say, do something that later you regret. Like I always say, don't. Like that man, the father of that child, they are still there, they are still alive. The man still regrets it. In fact, he's having a very terrible old age. He flogs himself, but he can't flog himself enough because the child has already gone. You understand? So these are some of those things. Don't leave the person alone. When a person is having, see, a problem shared is half solved. When you see that person is going through something, please always give a shoulder to lean. I know the world is bad, you know, but if your empathetic side, if you put humanity in view, you will break certain protocols regardless of how the world is. It's just like some people still lend a hand. They still help others. Like I would soon have a free training on a basic life support, CPR and first aid. I think BCC UK, MJB management is going to take that training. So I also advise and crave your indulgence that you should have that training. It's good. You find out that when something happens to someone, person is lying between life and death. You see people pass by and they ignore the person. They show less concern. It is because of what is happening in the world. But don't forget that in the midst of all those people that will pass, one person will still stop to help. Why? Because the person places humanity in view. And if you place humanity in view in anything you do, it will break certain protocols. It will break certain things. It will cross so many rivers to overcome what is happening in the country, in the world. It will break all those protocols because your humanity is in fear and you want to help the person. Don't leave the person alone. Don't say, even if the person is your worst enemy, don't leave the person alone. Try to lend a hand. Try to give a shoulder to lean on. Try to talk to the person. At least let it be that you did your best and your best was not good enough than you not doing your best at all. That will be worse. So call helplines, emergency departments. We have so many. Reach out, ensure that the person has safety contacts available so that you can do whatever you have to do when you do it. Yes, I said I won't exceed 8:15, and I mean it. We just have 2 slides, 67 and this 64 will be done. Thank you for staying with me this far. So talking with a suicidal person, listen with empathy and don't be judgmental. Like I said, even if it is your child, yes, even if it is, I don't know, even if you are angry about the whole situation, when you see that kind of situation that the person is, forget about being judgmental. Listen with empathy. Don't interrupt with stories of your own. Let the person talk. Allow the person to come out, because they say out of the fullness of the heart, the mouth speaketh. And out of what the person is speaking, I don't know if that's also in the Quran, but in whichever religion, you know that someone speaks out from the fullness of the heart. You know, so allow the person to talk, because talking out, it's a therapeutic, it's a form of therapy. It helps the person. Many people that shoulder and stomach and keep a whole lot of things, traumas they've passed through, it affects them more. But when they are able to break that resolve and begin to express themselves and talk to people, share what they are undergoing, share what they have been through, it's a healing process. Automatically, they are healing from it. But when they leave it there, it doesn't help. So listen to them. Don't use threats or guilt to prevent suicide. Don't use threats. Don't say, yes, if you kill yourself or this. No. Because at that time, it's a mental illness. So you can't just get to them. The only way you can get to them is being empathetic. Let them know that you feel what they are going through. Let them know that you feel their pain. At the same time, also let them know that they are not alone and that that's not the only way out. Help them in the way you can. Try to obtain a verbal agreement that they will not harm themselves within a certain time frame. Never keep a person's plan of suicide a secret. I think that one is self-explanatory. So we have certain myths, misconceptions about suicide as well. That suicide is a spontaneous act. It's a lie. Like I always tell people. Well, let me not outrightly say it's a lie, but most of it is not true. Most of it, it's always suicidal ideations, thinking of the suicide, thinking of it. What will I do? What shouldn't I do? From depression, anxiety disorders, it gets going, it gets moving higher. Why am I even here? Despite all these things, what's happening to? And the worst is they cannot express it. Fine, before it gets there. So it's not spontaneous at all. Some people think nothing can be done about it. It's a lie. Suicide attempts are seldom repeated if handled properly, if the right thing is done. So chances of suicide can be reduced by not talking about it. Some people think so. If they don't talk about it, no, it cannot be reduced. People who talk about suicide don't take their own lives. Some people think so. It's not so. So the bottom line is these things I've said is not cast on concrete. There are many ways to help this. So the one that suits you better, especially if you are dealing with a loved one, you know how best to attack the situation. Maybe you have someone that is agitated, is angry, maybe a mother, I will do this, I'm leaving, I'm doing this, I'm doing that. If you just have that person's secret key, you know that this is a mother that does not joke with the children, and this is you can use it. Oh, you want to leave or you want to kill yourself, who is going to take care of your child? Your child loves you so much. These children are so, but once you say, in a way, it weakens their resolve. When you get the things that a person loves most, you attack it from that angle, it weakens that person's resolve. And at least for some time before you are able to do the right things or to seek help for that person. So suicide and stigma. People with suicidal ideation can be considered weak already. If a person has the track record of committing suicide already, the person is considered weak. The world sees that person as weak. They can even be judgmental. Why? You see that Joy? Joy wanted to kill herself. You see her, have you forgotten that time she wanted to kill herself? Is she the only one passing through that? What kind of a person already? Stigma is there. That's why some suicide attempts are not reported by families, because they know that the stigma will linger in that house forever. Especially the worst is for any family that have lost a person by suicide. Sorry. Especially in Africa, it's a song in the lips of anybody that. So these are some of the things that we should not permit, or we should see how to enlighten people. Families of victims can be stigmatized, like I already said. Stigmatizing language should be avoided. Some died by suicide, not committed suicide. They say, that person committed suicide is harsh. It's harsh, but the person died by suicide, it's lighter. Some of these words, if you are a psychologist or you are into, you will see that there are that the words we use, you have to filter them, because there are some words that are heavy when you bring them out, and there are some that are light, but they may mean the same thing. So if you are trying to salvage a situation, you use the words that are lighter, the words that are not heavy. You see how to handle it. Just like in caregiving that I just had the other time, when you don't say that a person is a deaf person. No, rather you say a person is having a hearing disability. So that is still the same thing. But when you say a person is deaf or dumb, you say those words like that. It's the way it's going. It's heavy. That's how we refer to it. It's heavy. So you don't, it's a form of stigmatization. It's a form of you belief. I don't know how to put it, attacking the person's self-esteem. But if you say, oh, that person has hearing disability, or she's a person, so these are some words that we need to know how to say, so that they don't sound derogatory or they don't sound perceived wrong way. So what's the goal of suicide prevention? It should be to reduce the stigma attached to suicide. That's one of the things. So summarily, as we've gotten to the last slide of this training, in summary, when we talk about this, what I want you to take home, what I want us at this juncture to take home with us is, in as much as we are trying our best to ensure that we fight these things, I want you to understand that it is not a walk in the park. I like to use that statement because I like to walk in the park a lot, and I know it's sweet and it's fun. So it's not a walk in the park. So whenever we are faced with such challenges, we should know that it can happen to anybody. As we conclude this training, this being the last slide, we should remember that mental health is not a destination. We have not landed. Even as we are having this training, we have not landed. It's not a destination, but it is a journey. And as you know, a journey takes time, step by step, till you get to your destination. So it's not yet a destination. We are still in the journey. So each step you take in this journey, no matter how small, brings you closer to a life of balance, a life of resilience, and a life of fulfillment. Be kind to yourself. Be mindful. Check your mental health. Be kind to yourself. Anything that wants to obstruct your health, your mental well-being, please cut it off. Seriously. Seek support. Be kind to yourself and be kind to others. Seek support when you need support, when it is needed. And never underestimate the power of your own strength and compassion. Never underestimate the little thing you do in showing compassion or sympathy or empathy to another person. Never underestimate how it can be, how important, or to the extent it can go. Together, I believe that together we can break this stigma thing. We can support each other, and we can create a world where mental health is actually prioritized and celebrated. You have that power. Everyone on this platform, Mr. Edafe, thank God for your what you are doing, like your profession, as well as all of us professionals here, regardless of whatever you are doing. You have the power to make a positive change starting today after this training. Let's just walk this journey together with hope and with courage. God being on our side, I think we would achieve what we want at the end of the day. So thank you so very much. We have come to the end of this training. I don't know if we have any questions, if we have any contributions. Please, in the next 2 minutes, let's get to it. I've not seen any question in the chat box, so I assume that everybody comprehended or understood what I had said. But we have come to with that, we have come to the end of this mental health awareness training, the second batch. So I don't know if we have actually learned anything. I would like to hear from you. I just need to hear yes or a no. I need to hear maybe 1 or 2 responses concerning the training, preferably a male and a female, so that we just take 2 and I hand over to MJB management. If the training has really been of use to you, because I don't know, or if I've been talking to myself for the past 3 hours, well, this is the time. I want to know how persons, at least on behalf of the others, feel concerning this training. Thank you so much. I think I need to rest at this point to hear from you. The floor is open, please, for anyone that wishes to say something. Thank you.
Thank you very much. I've learned.
Thank you
I've learned
too.
a lot.
You too.
I want to plead that if you can give us a summary of this, your work, like a note, I would like to read and know, even if it will cost paying for it. I don't know, not also me. I don't want to speak for everybody. I don't want.
Okay. You know, so that my mental health will be, Mr. Edafe. You know, we are talking about mental health, and we said that you said that some people commit suicide or they feel very bad because of the financial situation of the economy. So I wouldn't mind if you can pay me. If you can pay me 5 million or 10 million for this slides, I'll make it available for you. If that's okay, so I can take care of my. He's laughing, Mr. Edafe. No, never mind. One thing MJB management is good at is they will certainly let you have the slides. In fact, as soon as I am done, I'll ensure that I hand over the slides, including the video, everything to MJB, and you would have it. They've been doing this.
Oh, thank you very much. Thank you very much.
So this will have it. You're welcome, sir. You're welcome. Thank you. So do we have a lady? My gender, is it that? You're welcome. My gender, please speak on behalf of my gender. Thank you. So I hand over and we. Oh, it's going to be sad if only the men will have to talk on this platform this evening to say something. Okay.
Okay, may I speak, please?
Chidima. Okay, yes, please do, sir.
Okay, ma. Thank you very much.
Martin.
Yes, ma.
Martin.
Yes, ma.
Okay, sir.
Okay, so I just want to comment on your delivery. It's been impactful and we enjoyed it. But I have a small question to ask.
Thank you.
Not too distant time ago, because I'm asking this question based on the fact that you said the suicidal attempts are thought over a period of time before it takes place.
Yes.
So, but there was an incident that trended in the social media about last year or so of a lady who a man proposed to, and he felt excited in that proposal. And shortly after, we heard that the lady committed suicide. But can we now conclude now that the lady had thought over this suicidal attempt before it took place? For somebody who was excited at a marriage proposal.
Okay, Mr. Martins. Fine. If you listened to me carefully, I know you did anyway. In the course of saying it a couple of times, I said that in most cases, I didn't actually say that in all cases, but in 80%, in fact, 90% of cases of suicide is actually thought about. It results from the ideation that actually gets to it. Now, in the case of that lady, though I'm trying to remember, I've seen so many of those suicides. I get interested when I see them anyway. Now, what I don't understand is, did the lady take her life immediately after the proposal, or at least she had even a space of 1 day? And then why did the lady actually commit the suicide? That's another thing I want us. Was there something that happened? Maybe the guy proposed to her, and maybe in the course of her being excited in the euphoria of the wedding, or of the proposal and her being engaged, she got to find out that water has gone under the bridge, or maybe the guy is not being, you know what some men can do. So maybe based on that, she must have ended her life. And I still put it to you that ending life, someone that knows her, that's why I'm saying that most times a close person, a dear person is supposed to keep tab of. Now she will have a friend, or she will have a mother, she will have somebody, because she wouldn't just immediately after the proposal be walking out of that place. She now decides to end her life. No, I wouldn't think it happened like that. I don't know, but I don't think it happened like that. So maybe after she enjoy and being happy. Okay, being happy that, I'm proposed to, like any woman will feel. Like, I can even remember when I was proposed to, the joy can even make you not to even sleep throughout the night because of the happiness, but she must have something must have happened, and she must have had time to ponder over that thing. It's not spontaneous. It can never be spontaneous. In fact, in 80%, it's never spontaneous like that. The person will have to see that, okay, now maybe the man, most times for a woman to do that, 2 things involved. Most likely that man must have maybe cheated on her, or she must have found out that this man proposing to me, he has a skeleton in his cupboard. Certainly. So if he has a skeleton in his cupboard that she's realizing, it will break her. It will break her. And depending on how emotional women are, and always at the receiving end of things, she didn't have the right people to talk to her at that point. The right things were not done at that point. And maybe that's why she ended up seeing that if I don't marry, or if this person can hurt me this way, then why am I alive? What's the reason of me being alive? All those things that happen sometimes. So I don't really know the nitty-gritty of the story from what you are saying, but I still repeat that it can never be immediate. No, because you will you would think before a person commits suicide, you must think where the pros in your head. Oh, I just think this thing is too much. I cannot bear. I just have to end it all. You must have some kind of discussion in your head, and it takes time. And someone that is close to you will see that you have recalled, you are gradually exhibiting certain tendencies. So the person has to act at that time, or else it can go beyond. So I don't know. I've just tried my possible best to explain that. Mr. Martins, are you okay with that explanation?
Yes, I'm satisfied. Thank you, ma'am.
Thank you, sir. So my gender, still nobody to build a cat. I'm not happy.
Hello.
Pardon?
Hello. Please,
yes,
there's something there's something that's very profound if we are to actually look at mental health. I still believe, I just did a work early this year. I did a work on traditional value. You can Google it. Traditional values.
Culture. Yes.
Yes, when I say traditional values, the African traditional value.
Culture.
And adolescent sexual orientation as correlate. Sexual orientation as correlate to something. When after doing that work, I found out that the culture, culture by extension it structures people. Because in our traditional value, what we see there that is very prominent is the values, the culture, the system. And I find out that most of the girls, because the population, the sample of the study was 14 to 22. And I found out that most of these girls, they already have the orientation, seeing themselves as this LGBTQ that we are looking at as a joke is something that is that has come to stay. And the family is doing nothing. The church is doing nothing. And at the end of the research, we found out that it is only two things that is keeping these children to actually exhibit this trait. Otherwise, they have this perceived nature. They already have this perceived nature to practice these things. They have this predisposition to do it. What is keeping them from not doing it? It is the traditional value. What are the traditional values? The stigma and the family name syndrome. Our family name, you cannot bring shame to the family.
Of course.
Otherwise, these children already have this tendency to actually carry out these things. Let's take it to this class now, which is mental health. Children that are confused with regards to sexual orientation. And when I use the word confused, when I use the word confused and purposive, yes, and these people, they are confused and they mistake it. And because I read a work last week, and Jeremy was looking at two concepts when you are to look at this thing that's this sexual orientation. We are arguing that most scholars are now arguing that this thing that is called sexual orientation, it can be understood from two broad perspectives. One is biological, and the other one is which is nature relationship. One, you can learn it. So why would you just say you learned this, you are wired like this, God wired you? Who wired you like that? And you can still learn it too.
Oh my God.
And you can still learn this thing too. So why am I asking this question? This question is, these children that have learned it, or they have actually believed, or they are wired like that, how do we mental health experts, or for me now, I already hate it. So how can I manage such a situation when I already have hatred for LGBTQ that is practicing this thing? And I will
say that. Okay. Okay.
No, it's a very technical question.
Well,
and I believe
thank
I have
God
one
you are also.
I have the psychology.
It is.
So let's talk like community of scholars. Because there is an endemic problem now.
Okay. Yes, it is. Mr. Dafe, yes. What you have just said is a very important issue you have raised. I know in this along the slides we've talked about culture too as one of the we talked about it. When you get the slides, I think it should be around that 30 something or 40, I'm not very sure, but in the slides. So what you have said, LGBTQ and all those things, again, don't forget that our culture, like you said, culture is even having the grip on us. Grip in the sense that, as you have said, the cultural aspect of it and our tradition, aside the stigma, has really made it to be, if you observe in Nigeria, in this part of our own world, people are not very open to coming out. Like they still have those little reservations compared to maybe UK, outside the country, that is even legalized. You know, for them, it's nothing again outside there. So it's something that gives us cause for concern, that I believe that if we want to talk about it, it's going to take time, because there are so many theories, there are so many schools of thought concerning especially that aspect of LGBTQ we are talking about. So, but the overall thing is we have a lot of work to do as mental health specialists. We have a lot of work to do. And as such, we have to put all hands together. We have to use all the resources within us. So what I'll actually do is, Mr. Edafe, I'll reach out to MJB Management and Integrated Services and ensure I have your details, because I think, like I said from the beginning, I'll need to work with you, because we have a lot of, I personally like to work with people that are in the field so that we can do our own little corners to see how we can better the world. So that's practically what I know. There are lots of theories. That particular issue of lesbian topic that we don't really have the time to do that, but would reach out, and perhaps for those that want to, because this is the certificates program, like I talked about, like someone like you that has, have attained certain heights in mental health, the levels. So you are going to be talking in a higher dimension from people that are just having a certificate course in, or just want to have the little mental health awareness and knowledge. So thank you so much, Mr.
Edafe, I think I'm certainly going to reach out to you soonest. Thank you. So on that note, MJB Management and Integrated Services, we've come to the end of
this. Thank you, ma. Thank you, ma. We are all learning. We are learning every day.
You are welcome. Thank you too. I've learned a lot too from everyone. So MJB, over to you. Thank you.
Thank you so much, Dr. Mrs. Itugudo. Thank you for the time. Thank you, our participants. We have come to the end of this program. So for those of us or those of you that are interested in getting the certificate, you know it's optional, but we just accept a token of 10,000 Naira for the certificate. So if you're interested, do same. Everything will be on the platform. Concerning the slides, I heard Mr. Edafe talking about the slides. You will have them immediately. Or not before tomorrow morning.
Yeah, thank you. I'm making payment now. I'm making payment now. I'm making the payment now. Thank you.
Okay. All right, sir. Thank you so much.
Please, MJB, excuse me, please. I just remembered something. Please. I forgot to talk about that. Just 1 second, please. I beg your pardon. I want to thank you, Mr. Edafe, for saying you are going to pay. Now, I want to crave your indulgence for all of you that have taken this training. It's important you have the certificate because no knowledge is wasted, and it's better for preparation to meet opportunity. You may have the need may arise that you have to in as you progress in life. So don't take any knowledge for granted, please. So please try. 10,000 is fair enough for all we've had today, and a certificate from BCC UK is something that is worth it. So please, let's think about Thank you, MJB. Go back to you.
Thank you so much. Thank you. Thank you, everybody. Good night. Good night. Good night. Have a lovely night.
Good night, everybody. Good night.
Bye. Thank you.
Good night.
Good night. Good night. Good night. Good night.
Good night. Bye, everyone.
Y'all get one certificate just now. That's how did you go to school. Ask me how much I pay $100. Masters